Good morning, everybody. Super excited about our panel today. I would like to welcome everybody to the Kauffman's Monthly Entrepreneurship Issues Forum. My name is JaNae, and I am a program officer focusing on research translation work at the Kauffman Foundation. It is my pleasure to introduce today's topic, healthcare access, and their impact on entrepreneurship, landscape, and policy considerations. This year, the COVID-19 pandemic highlighted two things. First, it demonstrated the complexity and stress facing entrepreneurs all over the world. In a recent Kauffman survey, 57% of business owners indicated that COVID-19 had a negative effect on their business. At the same time, half of business owners reported self-doubt and fear as a challenge facing their business. Second, COVID-19 highlighted the critical importance of healthcare systems to entrepreneurship. A survey conducted over the summer found nearly 1 in 3 businesses were not sure if they could keep up with premium payments beyond August 15, 2020. This would have significant long-term impacts on healthcare access and delivery. Small businesses were also slightly less likely to offer health coverage benefit than they did before the onset of COVID-19 pandemic. This reduction in health insurance offerings was more pronounced in businesses that did not receive the Paycheck Protection Program approval. Today, we are going to explore questions at the intersection of mental, physical health, access to healthcare, and entrepreneurship. How does an individual's health status impact their decision-making about whether to start a business? Does it matter if they have a sick family member or themselves have a medical condition? How does health insurance affect the decision whether to start a business? And when someone does decide to take the plunge, grueling realities and uncertainties of starting a new business can take a physical and emotional toll. Because of that, we want to explore what efforts are being undertaken to help alleviate health barriers to entrepreneurship. How can we better support people who want to be entrepreneurs and who are entrepreneurs? Our speakers today come from diverse backgrounds in research, private practice, policy, and the nonprofit sector. Panel 1 brings together researchers who investigate how health status of individual entrepreneurs influences their choices relating to their business ventures, and how, in turn, the choice to start a business impacts the health status of entrepreneurs. Our roundtable brings together healthcare professionals and providers to discuss their approaches to serving entrepreneurs and how to best address their healthcare needs. Lastly, Panel 2 brings together researchers who study health insurance marketplace, federal and state regulations, and healthcare access for entrepreneurs. We hope that during our time together, we can learn something new about the challenges that exist at the intersection of health and entrepreneurship and how they are being addressed. This seems especially relevant in the time of the COVID-19 pandemic. We host this forum to provide a platform for an in-depth discussion on how to solve problems. And the Kauffman Foundation does not take a political position or legislative position on these discussions. I would like to thank each of today's participants for taking time out of your very busy lives to share your insights. And with that, I will turn it over to the moderator of our first panel, Dr. Micahel Lerman from Iowa State University. Dr. Lerman, please take it away.
Thank you very much. Good morning, everybody, and thank you for your attendance this morning for the panel discussion on what we know about the health status of entrepreneurs. My name is Micahel Lerman, Assistant Professor of Entrepreneurship at Iowa State University. I'll be moderating the discussion. We're fortunate to have 3 excellent panelists on the topic. We have Dr. Yuleinys Castillo, Assistant Professor of Clinical Rehabilitation and Mental Health Counseling at California State University. We have Dr. Gish, Assistant Professor of Entrepreneurship at University of Central Florida. And we have Dr. Stephan, Professor of Entrepreneurship at King's College London, Visiting Professor at TU Dresden, and Honorary Professor at Aston Business School. To start the discussion, each panelist will have 7 minutes to speak about their knowledge and perspectives on entrepreneurs' health. Panelists, to help facilitate this, I will time your 7 minutes, giving you a 2-minute signal and a thumbs up when your time is up. Then with the remaining time, we'll open the floor to questions from the audience. Audience, while the panelists are speaking, please feel free to type in questions, which I will then read aloud for the panelists to answer during the open discussion time. With that said, I would like to start by giving Dr. Yuleinys Castillo the floor.
Good morning, everyone. In the next few minutes, I'd just like to talk to you about the idea of well-being and how health is so important to keep in mind for entrepreneurs, right? So with that, the first thing I like to talk about, and I don't know if this, oh, there you go. So I want to talk about this from the perspective of health, right? And the understanding and keeping in mind how health has multiple components and multiple levels that affect the general well-being of an individual, right? So we can talk about health from a physical, keep in mind the physical components, mental components, and the social components that are all interconnected and affect the general well-being of anyone. At the same time, as we're trying to understand this idea of health, we also want to keep in mind the lifestyle, the impact of the lifestyle that anybody chooses to pursue, and at the same time, how work plays a huge role in our health. And of course, what I would like to discuss at the end of my 7 minutes is the power of self-care. And we utilize self-care to improve our general health. With that in mind, just very quick, some data for related to mental health among entrepreneurs. And of course, coming from the disability studies area, it's very interesting to keep in mind that the individuals with disabilities are twice as likely to be entrepreneurs compared to individuals without disabilities. Now, with that in mind, of course, looking at some data, we can see that about 45% of entrepreneurs are more likely to be stressed than individuals in the workforce, which is about 42% for this population. Now, they also have reported that they worry too much, and that's about 34% of entrepreneurs have reported that they worry too much compared to 30% of individuals employed. Now, when we're looking at specific to some mental illness, to some mental disabilities, depression is about 30% more common among entrepreneurs compared to 16% among employees. And then we can also talk about attention deficit hyperactive disorder, ADHD. About 29% of entrepreneurs may have it compared to 5 to 4% of individuals who are employed in the workforce. Then we have substance abuse issues. Again, it's much higher. And then another common mental illness is bipolar diagnosis among entrepreneurs. Now, we also want to emphasize that it's very important for us to keep in mind the value of entrepreneurship, right? The value that brings to the individual, going back to the idea of health, and keep in mind how work can actually help to sustain a health status, right? Some of the values that, as you know, it's flexibility, and flexibility translates in multiple areas. The flexibility that could bring to the individual. At the same time, it allows people to make a living. Also, they have the power of choice to some extent. They can decide how many hours they work, but of course, that could also be problematic. It may be too many hours, the nature of the task, what kind of responsibilities they want associated with the startup, and of course, income. It's also some of the choices they may have. And again, going back to this idea of health and well-being, the sense of connection, right? For some individuals and entrepreneurs, that can give them a sense of connecting with the community, connecting with others, right? Again, which can help to sustain a healthy well-being and sustaining health. Now, of course, some of the mental health issues that I mentioned, some of the conditions, specific disabilities that they may struggle with, but I also want to keep us in mind that chronic stress is also a problem that may affect some entrepreneurs, right? They're more, as I mentioned earlier, they're more likely to experience stress than others in the workforce, but at the same time, some behaviors could also affect their general well-being. Some of them may forego sleep, that may also damage relationship with friends, with family members, and at the same time, they may also decrease their exercise, and sometimes they might skip meals, and they may not necessarily have the healthiest eating habits. Also, as a result of chronic stress and as a result of some of their decision or some of their behavioral decisions, that could lead to headaches, heart problems, high blood pressure, and of course, chronic stress can also lead to memory loss, anxiety, depression, substance abuse issues, weight gain, suicidal thoughts, which leads to one question that I would like for you to keep in mind. Is it this entrepreneurial venture leading to this mental illness, or perhaps in some cases, we also recognize that individuals with mental illness are choosing to become entrepreneurs. So we do see this connection between mental disabilities and, of course, the decision to become entrepreneurs. Now, with that, one of the things that I think it could be valuable for us thinking about entrepreneurship is the value of wellness. And of course, coming from a therapeutical perspective, it's understanding how individuals, we can be very active about becoming aware and making the choices towards a healthy and fulfilling life, right? What can we do as individuals to improve our general wellness, right? And it's very much a conscious effort. If we go back to the definition of entrepreneurship, we can all agree that entrepreneurs are very much self-directed. They have that motivation to make decisions. So it'll be about integrating this idea of wellness in their decision making, and at the same time increasing their sense of awareness of how can they improve their general wellness and how they can fulfill their full potential. So again, there's just a quick holistic approach to wellness. We can look into the emotional component, occupational component, physical component, social component, intellectual, and spiritual. So these are the 6 dimensions of wellness that entrepreneurs can explore to increase that sense of fulfillment in their life. Now, really quick, so some general tips that we can keep in mind to improve entrepreneurs can improve their general well-being. Anticipation. That's the idea of planning for something fun. Well, when I get home, I'm going to watch a movie. I'm going to go and exercise. So creating that sense of anticipation. Relaxing. Again, relaxing looks in so many different shapes and forms for everyone. Whatever works for you, right? Of course, a healthy way of relaxing. I do want to point that out because as we saw earlier, if it's an unhealthy behavior, that can lead to some dependency issues. Meditation, knitting, walking, music, and anything other type of healthy relaxation. Exercising, as you saw earlier, of course, can also improve general well-being, general health. Talk. Research has found that just talking about the stressors, just talking about your experience, connecting with other entrepreneurs. It doesn't necessarily have to be talk therapy, but just talking to other people, sharing some of these emotions can help to decrease the stress level, but at the same time, it can improve their entrepreneurial experience. Sleep. We all know the value of sleep. That's very valuable. Please sleep. And of course, as many hours as you need to, but of course, it's recommended at least 7 to 8 hours a day. And finally, because of COVID and because a lot of us are working from home, ergonomics. Make sure that you set up your workspace. Make sure that you make accommodations so you can sustain your posture and you can avoid any other potential physical disabilities as it relates to your work setting. And of course, please make time for your self-care, everyone in this webinar today. Thank you.
Thank you so much for that excellent discussion. And now I'd like to pass it on to Dr. Gish.
Okay, thanks. I want to talk about a lot of the same stuff that Yuleinys was talking about. So thanks, Yuleinys, for setting this up and for introducing me, Michael. I first want to introduce myself, tell you who I am. I'm a former entrepreneur. I had a business and grew it for 7 years and sold it to a larger competitor. So I had a successful exit. And Jonathan Zandberg asked the question, what type of entrepreneurs are we talking about here? And my definition of entrepreneurship is just anyone who is self-employed. So that could be people who are just working on a business solo. It could be people who have employees. It could be people working on high growth ventures. So I'm kind of pooling all entrepreneurs together. There are times where I do research and I'm looking at a specific type of entrepreneur, but what I'm talking to you about today is anyone who chooses self-employment. And a lot of my research in recent years has been on the notion of sleep. When I was an entrepreneur, I uttered this phrase a few different times, and even in the presence of other entrepreneurs, I'll sleep when I die, or sleep is for weaklings. The idea that my business is so important that I need to spend as much time as I can, and that whole sleep equation can just wait. And there's a trade-off associated with sleep, right? I mean, if you sleep less, there's more hours in the day to work. But there's some specific detriments that come along with less sleep, and there's recent research by myself and others. The first one there is you experience diminished creativity and stifle your innovation, your ability to think up new ideas. You have fewer ideas, lower quality ideas, And one interesting notion is this idea of the sleep trap. So this is people who might be considering a career in entrepreneurship. Brian Ghania came up with the idea that not sleeping might cause people to have greater ADHD-like symptoms. These are not clinical diagnoses of ADHD, but symptoms that mimic ADHD. And that might cause you to chase shiny new things like entrepreneurship. And so he wrote a theoretical paper about how it could pull you into entrepreneurship, but then leave you short of the means that it takes, like those first 3 bullet points on the slide in front of you, leave you short of the means that it takes to actually practice entrepreneurship. And that's why he calls it a trap. And recently we published a paper together that suggests that, yes, indeed, when you sleep less, you have greater ADHD-like symptoms, which might nudge you to a more entrepreneurial or self-employed career. And then, of course, once you're practicing entrepreneurship, you suffer from those first 3 bullet points if you continue to sleep poorly. So I'm going to encourage you to sleep. I've got some other recommendations later in the presentation. But before we do that, let's take a step back at a little higher level and look at entrepreneur well-being. There are several different types of well-being. Hedonic is just if you're feeling good, or the opposite of that is feeling bad. So are you happy and energetic, or are you sad and depressed? We can measure that. That's usually how traditionally entrepreneurs have measured whether they have high well-being or low well-being. There's also the idea of eudaimonic well-being, and that's basically, are you living a meaningful life? And some people pursue entrepreneurship to reach their full potential, and that's an example of eudaimonic well-being. And then recently, it's not a recent idea, but I've thought about this idea of a psychologically rich life, and somebody just did some writing on that. Professor Noishi, who talk about how entrepreneurs pursue entrepreneurship. Well, I'm bringing it to the realm of entrepreneurship, but they talk about how people might pursue something that's really hard, and I think like entrepreneurship, because it leads to a more psychologically rich life, something where you can avoid the mundane. You know, entrepreneurs are not button pushers. They don't experience the same thing from day to day, and I know this from experience. There's no shortage of exciting, action-packed, sometimes infuriating days as a person who's self-employed. And I think it leads to a more psychologically rich life, and I plan to explore that in the future. And recently, just last year, Johan Weikland and others have brought these well-being definitions to the realm of entrepreneurship and said, not only are we worried about well-being, but for entrepreneurs specifically, we're worried about how entrepreneurs feel about being happy, sad, living a meaningful life in relation to coming up with an idea, pursuing and growing their business. And so that's what I'm talking about when I'm talking about well-being, is specifically for entrepreneurs. Entrepreneurs experience a lot of stressors. There's recent research that comes out that different types of stressors are good or bad for entrepreneurship. Our session moderator, Michael Lerman, just published a paper in Strategic Entrepreneurship Journal talking about how challenge and hindrance stressors lead to different well-being outcomes. If you can view a stressor as a challenge, then you can have better well-being outcomes. Or if it's viewed as a hindrance, they have a meta-analysis that looks at many different studies that suggest that hindrance stressors detract from well-being, and challenge stressors can help you think about overcoming hurdles that are in your way. There's another paper I want to mention by Uta Stephan and colleagues. You're going to hear from Uta very shortly here, right after I'm done talking. And she and her team talk about constantly solving problems as an entrepreneur and ruminating. You experience these stressors, and you both cognitive and affective or emotional stressors, and those the cognitive problem solving, continually thinking through things even after the workday is over, can lead to lower well-being outcomes. And entrepreneurship is an emotional roller coaster. And when you experience that emotional roller coaster as an entrepreneur, you can continue ruminating on those things, affecting your evenings, affecting whether or not you can go to sleep, and leading to worse well-being outcomes as a result. So this is contemporary research on the idea of stressors. And I also want to acknowledge that there are a lot of trade-offs that exist in the realm of entrepreneurship. I mentioned the sleep trade-off before: more time in the day, less sleep, but some perhaps poor outcomes that result from that. There's greater autonomy with entrepreneurship, which leaves you with more freedom and control. You might want to leave the realm of organizational employee to become a freelance entrepreneur who's working for yourself, which leads to higher subjective well-being. So entrepreneurs report higher well-being, but it also leads to more work hours. Just like anybody who can choose to set their own work hours, on average, they work more than people who have their hours set for them. And entrepreneurs are no exception to that. It means that you have less time for recovery, or you make less time for recovery. Entrepreneurs do difficult work with a lot of responsibilities. And paradoxically, they have a greater need for recovery, but they make less time for it because they feel like their business is so important, like I mentioned when I was talking about sleep earlier. And that recovering from stressors can, on a continual basis, can lead to a breakdown of your body over time. And there's research that suggests that repairing your body or bringing your body back to stasis over a long period of time can have negative objective health outcomes. And so there are trade-offs to these things if you choose to be an entrepreneur. And you might be asking yourself, okay, what can we do about this? And so we've got some suggestions. Amanda Williamson in New Zealand and Uta Stephan, who you're going to hear from shortly, she's in London. We're working on a paper that suggests this is how you can fix this, even though you're dealing with these trade-offs in entrepreneurship, this is how you can fix these poor well-being outcomes. And so we have the 3 R's that we suggest, respite, reappraisal, and regimen. Respite is just, taking a break, taking time to listen to music, get out of nature, or socialize with others. Reappraisal is thinking about things in a different way, and you don't necessarily have to go to the trouble of cognitive behavioral therapy. You can just think about framing your issues in a different light. That can help you sleep. It can help you. It can help you think about things that you might be doing as an entrepreneur in a different way. For example, if you're pivoting and you're shifting your business's direction. If you can separate yourself from the business, you can make a pivot more easily without getting stressed out about that. And it can also help, CBT can also help you with failure. If you experience a failure event, or you're a serial entrepreneur and you've had some failures and you're looking for a win, you can reframe that as though it wasn't your fault, but it was just contextual factors and how the business was approached at the time. It might have been that you were too early, but reappraisal can help you think about things in a new light and frame the issue that you're dealing with in a way that you're not blaming yourself. Entrepreneurs go through a lot of self-doubt and self-blame, as Yuleinys suggested earlier, and reappraising that stuff can help you get to the next step and be more productive as you move forward. And then regimen is just adding structure. So setting a schedule to both respite and reappraisal can help you get to the point where you're feeling like this is a regular practice for me. It's not something that I have to try so hard to do, take a break or reappraise my thoughts, so that I'm not having these self-doubts and self-blame. And those are our recommendations, the 3 R's. So I'm happy to continue the conversation. I'm looking forward to your questions after we're finished talking here. And feel free to reach out to me online, and I'd be happy to refer you to any of those papers I talked about. I'm excited about this realm of research, and I think there's a lot left to be done to understand entrepreneurs' health and well-being. And I thank you all for attending today.
Thank you so much, Steph. And now we'd like to go to our last panelist, Dr. Uta Stephan.
Thank you very much for having me. And, tough act to follow, Yuleinys and Jeff. I think you've done an excellent job already guiding us into the topic. And you'll hear some repetition from what I say, but hopefully that's we can take this as these are really important points. So what do we know about the well-being of entrepreneurs? 2 years ago, I published a systematic evidence review, and I think I was both astounded by how much research there is, but also surprised by how little we know at the same time about entrepreneurs specifically. And I don't want to go through all the details, but just some key insights. And so the side which we know still less about is actually how entrepreneurs' well-being is important and how their mental health matters. And there's some emerging findings which suggest entrepreneurs care about their well-being, and to the extent that they forego financial benefits or delay exit from entrepreneurship, even though it's no longer financially sustainable, to protect their well-being. The other aspect that we actually now see coming out also from longitudinal studies is that well-being matters for the entrepreneur's business. So it matters for staying an entrepreneur, for persisting in the business. It also matters for their performance, for their success, for their creativity and innovativeness. And Jeff already presented some kind of studies that kind of go into the micro foundations of why this is. And the part that's perhaps least explored is we do think actually there's a strong case to be made. And again, there's very little research, but some quite impressive findings that entrepreneurs' well-being matters for others. It matters for their life partners. It matters for their children. So growing up in an entrepreneurial household is both a good thing, but also a challenging thing. We see practically that investors, VCs, for instance, start to care about entrepreneurs' well-being because they see it as a way to safeguard their investment. And so there's still lots to learn on those aspects. And then the second insight is that there is a whole lot of different drivers of entrepreneurs' well-being. And I think the multifacetedness of those drivers we may have underestimated so far. Because a lot of what the research does, it looks at well-being resources and well-being drains or stressors, and often takes those kind of theories from employees. But entrepreneurs are very different from employees in many different respects. And I won't have time to go through all those different aspects, just maybe to highlight, because we already had a question a bit on personal characteristics. So there is both something about certain people self-selecting into entrepreneurship, and then there is something about the nature of the work that impacts your well-being while you're an entrepreneur. And it's not either or. So even if you control for self-selection effects, we see that still the nature of work and the stresses entrepreneurs are exposed to have a fundamental impact on their well-being. So I do want to highlight two aspects. The one is we've already heard about the nature of entrepreneurs' work. So entrepreneurs' work is special in a very positive sense. So you have a lot of autonomy, but actually, and that's probably the aspect that's most, has attracted most research attention, and we have quite good findings there. But actually what's been overlooked, and it came through some of the earlier presentation, is the meaningfulness. So because you create your own job, you can set the parameters of how your business is going to look to kind of a very large degree. The business becomes part of yourself. The work you do feels important, worthwhile, significant to do. And that's actually something that has an even stronger impact on entrepreneurs' well-being than the autonomy. But at the same time, and Jeff already talked about paradoxes, and Yuleinys also acknowledged that there are many well-being drains. There kind of is intense workload, long working hours. There's very permeable work-life boundaries. There's lack of social support. There are additional social stressors when customers complain, or you have to lay off an employee, or employees complain, that I think make being an entrepreneur extraordinarily challenging. And then there might just also be too much of a good thing. So the paradox, yes, you have autonomy, but then do you really want to make all decisions when it's not at all clear what the next step should possibly be, when uncertainty is so big and so large that it's actually, there is no way of knowing? Then autonomy may also be a burden, or at least a double-edged sword. And also meaningful work, we know, can become an obsession. And then we have something that entrepreneurs clearly are much more exposed to than employees, who have maybe at least the organization around them buffering the effects of kind of the immediate crisis, for instance, or the market context. And what's surprising when we look at how business and financial resources or the market context impact entrepreneurs, for instance, when it comes to the success of entrepreneurs, it's actually not the financial success that really kind of impacts their well-being. It's how they perceive themselves to be successful. So whether they think they are successful, and their effect sizes are much bigger. So it's about meeting your own goals, surprisingly perhaps, or maybe not so surprising depending where you come from, rather than kind of the actual cash you generate. But and the downside of this is clearly that financial problems, shocks and crises are especially stressful. And it goes back to they are stressful beyond their actual impact on the business, because we think it is a way of kind of threatening your identity, right? If work is so very meaningful and is part of who you are, then if there is a shock, that kind of may undermine your image of yourself. So that then leads us neatly to COVID, and we've already heard that COVID is particularly challenging for entrepreneurs. So we've just, we're in the process of doing a large-scale study of entrepreneurs, business owners. We also include the self-employed. That was a very valid question early on. 22 countries, and that's nothing I can do on my own. So Przemysław Szpirowski at King's College is joining me in this, as are all these people. So at least I want to acknowledge them. So it's a great team to work with. The messages are less optimistic. So across these 22 countries, which make up roughly three quarters of the world's GDP, what we see is that entrepreneurs are feeling really the very existence of their business, see the very existence of their business as threatened. And what we see is, so if you ask them, how long are you going to last if the current situation continues, when do you run out of money, the average is 8 months. So you see that none of the countries we surveyed, entrepreneurs get even close to a year. So it's a very significant crisis. And then less surprisingly, that obviously has an impact on entrepreneurs' well-being. So if we match our samples to pre-COVID data from population representative samples, what we see across the board is that life satisfaction is going down with the COVID crisis. And what we also see, and I don't have a slide on this, is that these impacts are significantly worse for women entrepreneurs. And you know, quite likely because they have a double load of, even in the developed economies, they still have to look after household and childcare more so than men. So what can be done about it? So one of the positive findings from this study is that we see that those entrepreneurs who perceive new opportunities in the pandemic, if you want to pivot in the pandemic, they seem to fare better. And for them, actually recognizing new opportunities for their business also mitigates the negative impact of the pandemic on their well-being. So we looked at how much loss in trading they had and kind of related that to their well-being and opportunities. So then actually for policy support, I've just been this morning in a session around policy support, and we all kind of see all these huge economic support packages, and they are important, and the entrepreneurs in our study certainly utilize them. But our findings around the opportunities actually suggest something, that maybe we can also think of a way of how we can incentivize entrepreneurs to explore new opportunities, how we can get them to kind of conduct smart experiments so that they fail fast and see whether there is a new area for their business. And then, what can be done about it is also to support entrepreneurs to develop their personal resilience in the crisis. And many of the things that Yuleinys and Jeff said come back here. So, you know, you need to safeguard your recovery, kind of learn how to deal with stress. And I don't want to repeat this other than to say this is very, very important to kind of safeguard the ongoing capability of the entrepreneurs to go and get through the crisis safe and sound. Thank you very much.
Thank you so much, Ute. That was wonderful. And now we'll be transitioning to the group discussions. I want to encourage those of you in attendance to add questions in. I'll start just from the top here. So Jonathan Zandberg earlier asked if you could elaborate on what types of entrepreneurs we are referring to in these conversations, and Jeff answered that a little bit. Jonathan went on to add entrepreneurs by necessity, growth-seeking individuals, self-employed, small business, employers, non-employers, etc. And so I guess what I would like to ask the panel based off that is, how do you think these processes we're talking about are maybe different across some of these different groups?
I can go first, maybe. I think that's a very important comment, but at the same time, we see, I think there's been a lot of emphasis in high growth entrepreneurship, for instance, and I think there's certainly some stressors that are unique, right? If you are self-employed, you may have less to deal with employees for a start, and they won't be a stressor. But on the other hand, we see that if you want, even for the self-employed, there is loads of positive things in their work, and some of the stressors are very similar. So it's not that, you know, you are independently, taking a risk, working for your own account and work. At the end of the day, you're fully responsible for your actions, legally, personally accountable. And I think that's really the big difference between being an entrepreneur, working for yourself versus not. And maybe to add on a slightly more positive spin, because also there's been a lot of discussion, necessity entrepreneur. So you become an entrepreneur out of lack of other employment opportunities. And even there we see that maybe they don't have the quite the same positive well-being benefits as opportunity entrepreneurs, but it certainly don't seem to fare worse than in paid employment. So if you compare them like with people who are in paid employment. So it suggests that there is something still positive about being an entrepreneur, even if it's a necessity entrepreneur.
Necessity entrepreneurs might be a little more stressed about their options, but the data pans out, like Uta just mentioned. It's not that they're having worse well-being outcomes because they're necessity entrepreneurs. But I think that another thing that I want to talk about is your access to capital. So if you are both necessity and opportunity entrepreneurs, their success depends on their access to capital, right? And going into the global pandemic and thinking about, I have less than a year of reserves to be able to run my business, even on these, this diminished amount of revenue that I'm bringing into the company. If you don't have generational wealth to go try another business or maybe try a different pandemic business, I think the pandemic can affect you mentally a lot worse than somebody who's in a different situation, who might be more resource rich, or at least have access to the networks that can supply capital to keep their business going, or let them try something else that might capitalize on the enablers that exist with this work from home environment. So I just want to add that if you think about the resources that are available to entrepreneurs, those can have a big effect. That can be on your shoulders as an entrepreneur, more so than just thinking about why you got into entrepreneurship in the first place. So I think when I was doing my business, I was constantly worried about making the cash flow through the business. And I don't want to let us continue this conversation without thinking about how generational wealth and access to capital plays a role in that well-being equation.
And I just want to add really quick, related to all the points that they had discussed, it's also keeping in mind policies and the impact of the pandemic. It's access to loans and how individuals who are entrepreneurs are less likely to be found eligible and qualified for a loan than others, right? So even access to potential funding sources could also be a challenge for this group of individuals.
Excellent. Thank you so much. And we have another question, and I'm sorry if I mispronounced your name, from Nomita Sharma. And they ask, during the pandemic, is economic health more important than mental health?
I think they're inextricably intertwined, right? If you're concerned about your business, and that entrepreneurial well-being definition that I gave earlier talks about, are you happy? Are you living a meaningful life in the context of starting and growing a business? Those two things are tied together. And again, I think that reframing things such that, the pandemic is not your fault. If you're an entrepreneur who's suffering through this situation, and we have some practitioners on the call, you have no way to control that. And so reframing the situation to suggest that this, even though you're experiencing an economic downturn and it might be affecting your business financially in a very real way, even to the point of failure, getting out of the notion of self-blame is something that's hard for entrepreneurs. I had a lot of contextual factors that affected me. I started my business in 2006 and took it through a very different type of recession, but definitely an economic downturn. And I was always tying myself up in the business and thinking about how I could do things better. And I think that weighed on me a lot. And I have a family with kids. I have a wife and 3 kids. And I think it was taxing on them too. I think reappraising things so that you could maybe separate the economic indicators from your own personal well-being may help with that. But I don't know if entrepreneurs will be able to totally separate those things and decouple their own well-being, their own personal well-being, mental well-being, and the financial well-being of their company. It's hard. but cognitive behavioral therapy has promised to help with that. That's the reappraisal that I talked about when I was speaking. And talking to other entrepreneurs can help. And that's why I'm glad that we're all getting together and talking about things now.
Yeah, maybe just to add to that, I mean, what Jeff says, it's absolutely right. And that's what we're seeing when we're talking to the entrepreneurs. So we've done webinars and trying to support them through the crisis. And it's something that they really recognize that, their mental health is on the line and with this crisis is threatened, and that they need to find a way to deal with that in order to sustain their business, not just the next month, but the next half year and possibly even longer. So I think, it's really inseparable.
Thank you. And now Amanda Elam is wondering if there's any research looking at the impact on marriage and family relationships.
So in my review, I think I found 3 studies. Maybe by now there are 5, but I think they're very few. But there is a big crossover going on between partners. So if the business is doing poorly, and that affects your mental well-being, that then also affects your partner and vice versa. So really there is, if you want, this triangle of the performance of the business and then the well-being of the person who's leading the business and the person who is involved in the household. And I think that we still know not quite enough about how that also impacts children, but there's some first qualitative studies that also point to important impacts on children. So it's certainly an area which we need to be very mindful of, right? So in terms of social consequences of the pandemic, they're not just economic, but those economic consequences also filter through to families, of entrepreneurs.
It also mentioned some research that is not necessarily about entrepreneurs, but it's about people who work in creative careers. And this is a measure, following people around and asking them to fill out diaries, checking in with their spouse to see how their behavior was at home that night. So people who work in creative careers, when they have a more creative day at work, they then take that home and they're less able to attend to the needs of their spouse. And I would call entrepreneurship a very creative endeavor. And so, you're always trying to solve problems and figure out how to make the next step as an entrepreneur. And so I think that just like those entrepreneurship studies that Ute mentioned, there's organizational research that suggests the more creative you are at work on a daily basis, the less able you are to be a family person at home, affecting your spouse and kids if you have them.
And now it's something that we're seeing with the pandemic, that individuals have to work from home. So there is not that separation sometimes of the different roles. And as we had mentioned earlier, sometimes they're thinking about work responsibilities and are not necessarily paying attention to family needs, and they might not be able to sleep well. It's because they don't necessarily have the ability or the space to separate work from family roles and, of course, responsibilities related to family dynamics.
Absolutely. Thank you. And we now have a question from Katrina Kessler, who asks, do you know of any research that reveals the specific conditions, both internally and externally, that result in dissolution of anxiety, even for a temporary period?
I would venture that goes into much what Jeff was discussing already, right? In terms of reframing. I mean, we know that one way to build resilience is accept what you cannot change and then kind of try and work on. So if there's an external crisis, it doesn't have to do with you. And kind of maybe also try and focus on the aspects that you can control. Also planning itself gives you some control. And then in terms of, that can help with anxiety because it gives you a sense, you're working on one first aspect. So then it kind of helps restating that sense a bit more, but yeah.
And of course, I mentioned the idea of talk therapy. Talk therapy has been found to be effective to deal with anxiety and address some of the mental and emotional aspects of anxiety. But now, and of course, CBT, cognitive behavioral therapy, is one type of that. But also something that could be helpful. It's mindfulness, practicing mindfulness, different type of exercises that can increase your sense of increase your understanding of the impact of anxiety. Mindfulness looks and translates in so many different ways. It's just about finding what's helpful for you. But quick examples of that is journaling could be helpful, relaxation activities Also, maybe even meditating is helpful for some of us. So it's just finding ways that you can increase and continue to practice mindfulness to be helpful in decreasing anxiety.
That's great. I'm glad you mentioned mindfulness, Yuleinys. That's something that I didn't mention when I was talking, but there's research that suggests that, I do research on sleep and how it affects your moods. And for entrepreneurs, in every single one of the samples that I collect, less sleep leads to greater anxiety. And so getting sleep is a recommendation that I have. But there's also research that suggests that if you're not able to get sleep, because sleep is not always a choice for people, mindfulness meditation can help stave off exhaustion, for example. So if you're feeling exhausted, taking some time out, and that's part of the respite equation that I talked about earlier, taking some time out and just being present, which is what mindfulness promotes, can help stave off anxiety and those anxious feelings that are unavoidably creeping their way into your life.
And, just to follow up on this discussion and talking about anxiety, now I know, Jeff, you talked about some studies and Uta has done a study recently as well on daily level well-being outcomes. And so when we're talking about things at the day level, like sleep, how innovative you are, et cetera, how you're coping with situations, I'm just kind of wondering how those translate to long-term outcomes. So this last question was about short-term anxiety. And so it certainly appears that sleep would be helpful for addressing short-term anxiety. But how do those day-to-day activities relate to longer-term outcomes, and what knowledge do we have of that?
Well, I also want to mention that, when I'm checking in with entrepreneurs on a daily basis, it allows me to compare entrepreneurs to themselves, their outcomes to themselves on a daily basis. And so even if someone only sleeps during, let's say I check in with entrepreneurs on a 2-week period, several times a day, each day, even if somebody on average only sleeps 5 hours, they're better at coming up with great ideas or at innovating in their business if they sleep 6 hours as opposed to 4. And so I want to make sure and mention that even if you're a person who feels like you don't need as much sleep as the general public, you still do better when you get good sleep. All right. So that's first. And then thinking about long-term, I mentioned a paper about what's called allostatic load, and that's how you recover from stressors. And so long-term, if you're always recovering from stress, and entrepreneurship is undoubtedly a stressful career choice. So if you're always recovering from stress, it can wear your body down. Your body tries to maintain stasis. That's what allostasis is. And so that load of trying to bring your body down and not be stressed, your body's constantly trying to recover from those stressors. Doing that over a long period of time can lead to adverse health outcomes over a long period of time. And that's probably the most succinct answer I can give to your question, Mike.
Thank you very much. Now we have a question from Jonathan Zandberg, and this gets a little bit, I think, into the topic of discussion for the next group. But he's wondering from a public policy point of view, and maybe looking at cross-sectional differences between countries, does access to free healthcare help mitigate all of these obstacles? And do we see an increase in entrepreneurship when access to healthcare improves?
I'll be interested to hear what the next panelists say, and that's why I'm going to hang out after we get done talking. Access to healthcare is difficult. I had to make those choices for myself and my employees when I had my business, and I actually had my business when the Affordable Care Act was passed, and the type of insurance that I had was really high deductible, and it was no longer considered insurance. So I went from paying a couple $100 a month in premiums to being required to get insurance that for my family costs over $1,000 a month in premiums. And so access to healthcare that doesn't break the bank is something that I'm keenly interested in. And I would love to hear what people say about that and how entrepreneurs are struggling with that now. It's not something I've thought about for a long time, but it affected me in a very personal way back when I was doing my business.
Yeah, I guess to echo that, I think the next panel has more to say, but I mean, living in a country in the UK that effectively has free healthcare, we have fairly high entrepreneurship rates. They've been rising over the last 10 years very strongly. But I mean, to infer causality from that is just a stretch too far. But just to say that, you know, a few European countries in the past have actually shifted how they provide healthcare to the self-employed in particular, because they have all been seen as a group of basically very affluent business owners, so they had to buy private insurance. But Austria, and I think now Germany as well, they've moved entrepreneurs into more the public healthcare systems, and it seems to have at least alleviated some of the burden. But it had a discernible impact on a, you know, rate change. I wouldn't go so far, but there's certainly been activity to think through that healthcare, access to healthcare, to cheap healthcare is important, especially for the smaller businesses.
And I was thinking about this as you were both speaking also, it's not so much the access to healthcare, but the fact that it's free, that makes a difference, right? As Jeff was saying, when you have to pay just a high premium, it might be more problematic than actually when you have to pay something lower. But it's not only having access, I think there is a need to educate entrepreneurs to actually utilize the healthcare system, right? And make sure that they get the treatment and they make sure they take advantage of having healthcare available to them.
Thank you. Now, I know we spoke about coping a little bit already. Jeff spoke briefly about respite, reappraisal, regimen. Amanda is wondering if anyone other than you guys, I guess, studying how entrepreneurs are actually coping with stress and generally what coping strategies and tools actually work.
A whole variety of coping strategies, right? So I think the work that Jeff and I are doing is really kind of focused on, you know, build-in recovery time. So to give your body a break, literally, and to be able to kind of recover those resources that you spend over the day. I think in terms of classic coping styles, there's been a few studies, but one of the interesting findings was actually that we typically see problem-solving coping styles as superior to emotion-focused coping styles. So emotion-focused coping style would be more, okay, I'm anxious, what can I do to calm me down? And for entrepreneurs, it seems they need both, which I guess makes a lot of sense. If it is a roller coaster type of job, you're gonna go through quite extreme emotions. So then the emotion-focused coping as a short-term strategy to kind of deal with the daily demands seems to be a useful one. But I guess what evidence would tell us more broadly is you also have to have also the problem-focused area. So that would go back almost to what I showed from our COVID study, right? Try and find new opportunities. Don't just wait and calm your anxiety when you see your trading dropping and you're seeing that you're running out of money, but you know, ultimately you also need to try and do something about it.
Amanda also mentioned some free apps and the use of technology to build in structure to your schedule is valuable. I don't want to mention any by name just to not play favorites, but there's plenty of opportunities for or existing apps that you can use to remind you to take a break, for example. It can, you know, I've got an app that reminds me to take time to do a mindfulness meditation. And I try and do that every day. I don't get to it every day, but that helps me reframe my thoughts and be present in what's going on. So I think practicing mindfulness can, you know, technology helps with that. And I actually pay for an app. So using the technology that is already in our hands and we're already looking at on a daily basis can certainly help in that estimation.
And I can share one. I think just taking a actual physical break away from work or from your tasks, responsibilities, that could be just as little as 5 minutes. And if you have time, maybe up to an hour, right? But taking a physical break, maybe from any of the mental tasks that you may have related to your entrepreneurial adventure, but also at the same time, try to find, it could be a little walk, it could be just stretch, it could be a quick exercise in your workspace that can help you to raise your heart rate. And at the same time, it can help you to emit some of the endorphins that we need, right? Some of the neurochemicals that we need for to release some of the stress associated with work.
Now, this next question, this is my question. It's a little multifaceted, but Jeff, you know, you've done all this work on sleep, but you also have had this past experience as an entrepreneur, and you also holistically, this group has spoken about multiple different types of well-being. We've talked about the psychologically rich life. Maybe that's why entrepreneurs pursue their business. So the first question for Jeff is, given what you now know about sleep, if you had known this back when you were an entrepreneur before, do you think you would have been able to hear and apply that advice? Or at the time, would it have been falling on deaf ears? And then more broadly, to the whole panelists, to the whole group of panelists, I'm just wondering if is this trade-off of you losing sleep or maybe sacrificing certain components of your well-being necessary in order to pursue this psychologically rich life? To what extent is that well-being sacrifice a necessary condition to achieve maybe some other valued well-being outcomes or achieving venture performance?
I think given some of the knowledge that I have now, I would have put sleep higher on my priority list than I did. I can say that. But I also acknowledge that sleep is not always a choice, not just because you have a lot of tasks to do in a day as an entrepreneur, as somebody who's self-employed, but also because you're ruminating on things or you're problem solving. And that causes you to, your mind is running. I would lay in bed and stare at the ceiling and think about, I got payroll to make. I've got 50 employees to pay, and they're not going to keep working for me if I can't pay them. And I was never late, but there were some times where I was really close. My employees didn't know this, so thinking about estimations like that and saying, oh, well, now that I know that I'm supposed to get sleep, I would have been able to sleep. That's not necessarily the case. So I think I would have made sleep a higher priority. I would have added more structure, to my daily routine. And I would also recognize that there are times where I need to make a big push. And those might have been times where I can tell you right now that there was a time where I rolled out a new small business server and just stayed up all night and then worked the next day. And I'm not a 20-year-old college student who does that very frequently. And I was in my 30s running the business, and when I did that, and I reminded myself that, like, this isn't working. You got to fix this. But I did get that, the server rolled out while people weren't using their computers, and I got that thing done. And I think I would have just taken the next day to recover, acknowledging that I am a person who needs to recover, and I can't just keep pushing through these walls.
I think the other part of your question was, well, no pain, no gain, so to speak, right? And I think it goes very much with what Jeff was just saying, that of course there are stressful periods, right? The stress and kind of the work isn't going to be evenly coming your way when you're an entrepreneur. You have to pitch, your blood pressure is going to go through the roof. So there are stressful periods of time, but I think there is a growing recognition that, you need to balance that, and that you can't do this forever among entrepreneurs as well. So I think it's, I don't think you have to suffer endlessly to be having a productive business. If anything, what our research collectively shows is that the opposite is true, right? Recovery can also make you more productive. So it's not actually a trade-off, it's a synergy.
And I think one of the challenges here would be, how can we educate entrepreneurs to take time for themselves? And I think that's a great challenge. And how do we translate what research tells us to the masses and make sure that they actually follow it, and they do take time to sleep, they do take time to take care of themselves, and all of those needs that can help with mental health and translate to a more successful business.
There is a very real culture. I gave a talk about sleep to an angel investing conference with 250 attendees, and there was a person who rushed up to me afterwards and told me, hey, I don't believe the findings that you have, and this is a person who's encouraging entrepreneurs to sleep less. And he didn't believe that my sample size was big enough, and all these critiques of my research. And I was like, okay, you have the experience of yourself that you're drawing on, so that's an N of 1. That tells you that, you don't sleep very much. Maybe you don't need as much sleep as everybody else, but you're encouraging everyone to sleep like you do. And I like Uta's suggestion that this is a synergy. We need to stop wearing lack of sleep and hard grinding 24/7 as a badge of honor. Stop wearing that as a badge of honor and recognize that humans need to recover. And your relationships with people outside of your business matter too. Not just because that relationship is important and the social aspect of your person is important, but also because it helps you recover. When you interact with other people it helps you recover so that when you come back to your work, you're fresh.
Excellent discussion. Thank you so much. And thank you for sharing some of your personal story, Jeff. We have about 4 minutes left. So real quick, I want to close with coming back to something in Uta's study on COVID, or Dr. Stephan's study on COVID, and finding that some of these impacts are worse for women. And for sure, some of that is going to be due to familial roles. Could also be cultural in certain situations. I was wondering if about how you think women can overcome these additional challenges that they face when trying to become entrepreneurs or succeed as entrepreneurs.
That's a really difficult question. And part of me automatically thinks, well, it's not really up to the women, right, to change everything they do. I mean, part of what we see in the UK, for instance, the UK has the most expensive childcare provision in all OECD countries. So you see a lot of self-employed women because they can't afford childcare and they need to find a way to make that work. And that for them, then stress goes through the roof in the pandemic, where then everybody else is also, well, sorry, but I mean, so I think there's a systemic question, is all I wanted to say. But there's also a good news story. So for instance, in the one thing that we saw in our study that seems to really kind of be a positive driver of well-being in the pandemic, in the opportunity, noticing new opportunities, there wasn't a difference between men and women. So it's not just all a story of disadvantage, there's also very many similarities. But yeah, I think what came through was that childcare and additional responsibilities at home were quite a burden. Although for some, we also had men saying the same thing. So I don't want to say it's just a very one-sided story. For them, sometimes it was a bit harder because the women were actually used to working from home already. So yeah, there's kind of new challenges. But I mean, we really ought to dig a bit more into those aspects because they're clearly very important.
Okay.
I can say something about that too. So we talked earlier about economic well-being and the access to capital. And one of the systemic problems that has existed between genders in entrepreneurship is access to capital. And so, and that problem seems to be getting worse, not better, in one regard. And I'll talk about that first, and then I'll talk about one way that it is getting better. So women receive, in 2018, there was a study that suggested women receive less than 2%, or right around 2% of venture capital investments. So these are later stage companies that are already on, so these are growth entrepreneurs and their growth opportunities, but women receive very few of those funds. And perhaps unsurprisingly, the people running those funds are by and large men. So I think there's a bias that exists. There's a systemic proclivity to choose male entrepreneurs over female entrepreneurs when you're thinking about investments, because it's not just that there are only 2% of women who are entrepreneurs. So that's a thing to think about. It seems like there's some adverse selection happening there. But one positive thing, and I get this from the research of Ethan Mollick at the Wharton School, is that crowdfunding can help balance out this access to capital. So women perform better than men in crowdfunding campaigns and actually raise more dollars than men do if you just compare gender to gender. And so there is a bright spot, but I think we need to work on this systemic bias that seems to exist and the adverse selection that's happening in high growth opportunities.
A big thank you to all three of our panelists, Dr. Stephan, Dr. Castillo, and Dr. Gish. And that will conclude our discussion here. Now I will transition over to Ms. Brooke Bell, Account Executive at Federal Health, to lead the next discussion.
It's great to be with you guys. I am Brooke Bell. I'm the Federal Health Account Executive at Ad Hoc, which is a DC-based startup that's dedicated to making government programs and digital services work better for people. For me personally, I spend my time thinking about how to help federal healthcare programs. And prior to joining Ad Hoc, I spent many years working in government on the implementation of the Affordable Care Act's health programs that support entrepreneurs and small businesses as one of the leaders of healthcare.gov's Shop Marketplace. The shop marketplace is the exchange that supports providing health insurance and tax credits to small businesses, sole proprietors, and entrepreneurs. So I'm super excited to be with you guys today. At Ad Hoc, we actually support entrepreneurs in their process of finding insurance through healthcare.gov by building tools to help them shop for health insurance options, understand what's available to them in their area, and connect with folks in their communities who can help them enroll if they need it. I'm coming from Washington, D.C., where we love to talk about tackling policy issues and programs and driving policy change, especially during this election time. And in that vein, we'll go ahead and transition into our program and policy innovations roundtable and introduce our panelists. So our panelists today are Dr. Allison Edwards. She's the founder of primary care physician at the Kansas City Direct Primary Care. We have Dr. Micahel Freeman, founder of Econa Clinical. He's the clinical professor of psychology or psychiatry at UCSF. Dr. Diego Mariscal and Dr. JaNae Taylor. So we'll get started by turning the virtual microphone over to Dr. Allison Edwards.
Hi, good morning. Thank you so much, Brooke, for the introduction, for giving us your background. I think this is going to be a really great conversation, especially based on what we just talked about for the last hour about the importance of self-care and sleep and everything else in developing resiliency and well-being in entrepreneurship. So I will give you first a quick background. So again, I'm a family practice physician, board certified in family medicine, and I am also a small business owner and identify as an entrepreneur as well. When I was in my training, residency is hard. It's, they literally have to cap the hours at 80 hours a week so that we don't burn out and so that we do get sleep and things like that. So it's a hard time anyway, but even in the midst of that really difficult training period, I started to get a little bit frustrated with the manner in which healthcare was delivered in the United States. Specifically, my patients would often ask me when I was recommending a treatment or recommending next steps for diagnosis, they would say, well, how much is this going to cost? And in all honesty, I would say back to them, like, I have no idea. I don't know what your insurance will cover. I don't know what I didn't even know what insurance some people had. And if somebody was paying cash, I couldn't even tell them how much it was going to cost if they were paying cash. And this really, really, really started to grind at me because inevitably patients would come back to me later and say, that thing that you recommended has put me over the edge financially, has ruined my credit, has put me into collections, et cetera. And that didn't sit well because part of the Hippocratic Oath is obviously to do no harm. And here I was in an attempt to create physical, mental wellness. I was actually committing quite a significant amount of financial harm. And so when I left residency, I took a leap and actually to just call myself out. I didn't realize I was starting a business. I didn't realize I was going down this path when I did it, but I took a leap where I decided to open up this clinic that I'm in today, Kansas City Direct Primary Care, where we've decided to take out all of the intermediaries in the healthcare process. And I work directly for my patients for a flat monthly fee. I don't charge any copays, and you can go onto our website and download the PDF of all of our prices so people can see exactly how much they will be charged by our clinic for any given service that we offer here at the clinic. So my goal is essentially to provide transparently priced, affordable healthcare services to anybody, regardless of their insurance status. So we're about to hit our 4-year anniversary of being open. I started out as, again, I was an entrepreneur, but I didn't even know it. When I flipped the open sign for the first day, on the first day, I was actually cleaning toilets and sweeping and answering the phones. And I was the IT support. So thankfully, we've gotten much past that. We have 3 physicians here, including myself, full-time nurse, medical assistant, and then several people who just kind of help us rotate in as what we call PRN in medicine. what has been interesting is actually the demographic that we serve. So we just completed our 3rd annual patient survey. And if I look at the income, we ask people, what's your income bracket? And it actually mirrors the sort of curve that there is in the United States, where we have a ton of people who are making, less than 16K, who are gig workers, 1099. We see it kind of curve up into the $50,000 a year to $75,000 a year. And then we have this long tail of people going out who are making over $250,000 a year. What's interesting, though, is that we serve a disproportionate number of small business owners, 1099 independent contractors and the like, because that's the exact population that has to be consumer focused when it comes to accessing healthcare and how to shop for health insurance and whatnot, because there aren't a ton of kind of finishing the conversation that was started last discussion about access to health insurance and options. There really aren't a ton of affordable options to procure vast coverage in health insurance. And so about 30% of the population that we serve are people who fall into that small business category. And it creates a lot of really interesting conversations, because I'm a small business owner. I'm also the physician. And so when I'm talking to the small business owners sitting across the table from me, we have conversations ranging from how do they take care of themselves? How do they procure, safety for their family from a medical standpoint, and sort of trying to plan for the worst possible outcomes, which is why you really should have insurance, all the way to how do I take care of my employees and how do I create a benefits package that makes sense to me as a business owner, because, my line items, the top line is going to be, maybe rent, and then your personnel costs, and then it's health insurance. And nobody starts a business to provide health insurance. That's not why people go into entrepreneurship. And so these are the wide-ranging conversations I have when I'm sitting here in my clinic with my patients who are the small business owners that make our community pretty awesome. They're the restaurant owners. They own small marketing firms. They're out there doing things that really create the communities that we love. So I'm really excited to have this back and forth conversation with everybody on this panel, because I think that we all have really interesting perspectives of the intersection of health and entrepreneurship. So I will leave it at that as my intro.
Wonderful, thank you. We will pass the microphone over to Dr. Michael Freeman.
Thank you so much, and I really appreciate being included in this fabulous conversation. I would like to give the Kauffman Foundation a lot of credit for expanding the dialogue around entrepreneurship to include this dimension. My goal right now is to orient everyone to the mental health issues related to entrepreneurship. And I've prepared a couple slides to help you with this. By way of introduction, I am a psychiatrist on the clinical faculty at UC San Francisco, an academic researcher of sorts, and some of the data that I'll present came from a study of the mental health conditions among entrepreneurs that was supported by the Kauffman Foundation, so thank you for that. I'm also a serial entrepreneur, and my interest is in trying to create scalable wellness and mental health solutions for entrepreneurs, since it's such an important and, in my view, overlooked issue. I wanted to start by just showing you a picture of Howard Hughes to kind of make this real, and attach a biography to the subject that we're talking about. I think everybody knows about Howard Hughes, who was a tycoon, a famous American entrepreneur who had serial entrepreneur with many businesses. Hughes Aircraft, started TWA, Hughes Tool Company, real estate, and who was mentally ill for his entire life, became psychotic towards the end of his life, and spent years in seclusion as a result of his psychosis, and left an endowment and a legacy that's helped support medical research. Icona is the name of the innovative, scalable mental health solution that my team is trying to create. It stands for extroversion, conscientiousness, openness to experience, neuroticism and anxiety, the genetically transmitted building blocks of personality. And these are some of the drivers of why entrepreneurs become mental health, and they're associated with mental health conditions. These are some people I'd like you to just take a look at. Again, I think you may know some of them. Kate Spade was an entrepreneur who created a fashion brand that was, her name symbolizes. And George Gosby from Canada was one of the business leaders of that country for many years. Autumn Radke started a digital Bitcoin and cryptocurrency exchange, one of the first ones. And these are all entrepreneurs who committed suicide. And in fact, it was a wave of suicides among entrepreneurs that kind of pushed me over the edge from research into trying to actually solve this problem. And I think we as a ecosystem, we as a community need to kind of get real with ourselves about the vulnerability of entrepreneurs. And yeah, it's great to have generational wealth as a backstop, but a lot of the people had wealth and it didn't make a difference. There's more to it than that. And so I'm hoping that, I'm trying to create a safety net, and maybe we can all come together and do something to prevent this kind of tragic outcome from continuing to happen. Regarding mental health as separate from well-being, because they are two different things, though they're related, in the 20th century, occupational health and safety was focused on physical medicine, because physical labor was the primary driver of value creation in the industrial economy. In the post-industrial economy, where knowledge work is the main driver of value creation and wealth creation, creativity and creative capital is actually a greater contributor to value creation than human capital. And the creative capital is based on social, emotional, cognitive, and behavioral agility and effectiveness. And social, emotional, cognitive, and behavioral fitness is just another way of saying mental health. So I think as we think about healthcare policy for the knowledge work economy and for the creative economy, the emphasis really needs to be on mental health as a priority in some important ways compared to what we grew up with, which was a healthcare system which is based on physical health. This is some data. You've heard some of this before already. I mean, the main thing is that mental health symptoms derail founders, and this causes personal adverse outcomes, but also firm level and ecosystem damage. Here's some data from a great study that was supported by this Kauffman Foundation grant, where we compared a really good sample of 1,000 entrepreneurs with 1,000 managers. And we found in this sample that 1.4% of the entrepreneurs had a prior history of psychiatric hospitalization, 3% reported suicidal ideation, 38% had diagnosable psychiatric conditions. This is a big number, and this is what entrepreneurs are bringing to the party with them, independent to some extent of what the party brings to them, the stressors and the social issues that they need to face. So I talk about entrepreneur mental health differences because illness, it does not accurately characterize what's going on for entrepreneurs with respect to mental health. And the way that I think of it is that there are basically three buckets of mental health differences. First, in the yellow circle here, what is known so far is that entrepreneurs if you think of the concept of neurodiversity, not all brains are the same. And the idea of neurodiversity emerged from the autism community, but it applies with entrepreneurship as well. And among entrepreneurs, there is a difference in I call it atypical dopamine physiology, which leads to these elevated levels of bipolar spectrum conditions, ADHD, behavioral addictions, such as workaholism, and then this particular personality profile that we're talking about, elevated openness, elevated industriousness, elevated extroversion, and less of the other two genetically transmitted personality traits. And with respect to the conversation about rumination, what I'd like to share is that there's a difference between rumination, which is associated with anxiety, and absorption, which is associated with openness to experience, and that entrepreneurs can have both, but we should be careful conceptually because they lead you in different directions. In the purple bubble here, entrepreneurs have been found to have pretty much the same population base rates of anxiety, substance use, and depression as the managers, at least in this study. But then there's the question of what does the party bring to the entrepreneurs? And these are the acute issues, trauma, burnout, and personal situations that result from entrepreneurship. In the acute issues, I would add precarity. We had the conversation about health insurance. There's a vast literature about psychological, social, and health outcomes of precarity. And entrepreneurs, I would put in a precarious bucket for two reasons. One is a lot of them live at or below the poverty level. And the second one is that the age of onset of mental illness is pretty much the same as the age of onset of entrepreneurship. And so we have like a coincidence of these things, and they may be interrelated actually. From a policy perspective, what are the access barriers? There are a lot of them. I'll call to your attention. Lack of awareness is one. People don't really understand that they actually have a mental health condition. Shame and stigma is a barrier. It's a profound barrier, actually. Particularly, we talked about how men tend to get the majority of the financing, and that the ratio of entrepreneurs tends to be tilted towards men. And in mental health, women are, in general, the greatest consumers of mental health care. They're more willing to ask for help. So shame and stigma can be a barrier for a cultural barrier, and a fear of losing the confidence of investors and fear of reduction in shareholder value is a big roadblock. Makes it hard to talk about. Cost of care is prohibitive. Access to care is very discouraging. Fragmentation of care is a huge problem in mental health. Lack of health insurance, and even if there are health insurance schemes, the coverage for mental health tends to be insufficient. There's a historic discrimination against people with mental health differences in the healthcare establishment, and that's reflected in inadequate coverage for mental health. And then if you do have health insurance, there's a shortage of clinicians. This is why I'm personally interested in creating scalable solutions, because there's just not enough clinicians out there to meet everybody's need if they could get into the office. And then if you do get into the office, a lot of clinicians are inadequately trained. As I showed in that previous slide, entrepreneurs have a very specific profile of mental health needs, and many of those needs are not fully understood by the mental health clinicians that are out there. And then finally, healthcare needs to be entrepreneur-centric. If we're going to create supports for entrepreneurs have to get healthcare. Healthcare has to be available to entrepreneurs in the way that they want to get it. So if you think about, I think about this as product market fit kind of problem. Here's an example. Aaron Swartz was a famous American entrepreneur who was the founder of Reddit. Many of you, my academic colleagues, use the Creative Commons licensing agreement to put their articles in the public domain. Aaron Swartz was the founder of the Creative Commons. And this is how he described his own experience. I have a lot of illnesses. I don't talk much about it for a variety of reasons. I feel ashamed to have an illness. It sounds absurd, but there still is an enormous stigma around being sick. I don't want to use being ill as an excuse, although I sometimes wonder how much more productive I would be if I wasn't so sick. And to a large extent, I just don't find it an interesting subject. My friends are amazed by this. Why is such a curious person so uncurious about things so directly affecting his life? Aaron went on to commit suicide. This shows you, like, to me, it shows me the back and forth related to shame and lack of awareness that goes on inside the mind of an entrepreneur with suicidal ideation. There are a lot of program and policy considerations that flow from what we know about mental health among entrepreneurs. I've outlined a little bit here. There's service and implications, creating scalable and accessible entrepreneur-centric mental health supports. That's what I'm trying to do. A lot of research implications for this related to clinical research, services research, education research, and policy research. There's educational program and policy considerations. How do you educate entrepreneurs? How do we educate academic entrepreneurship programs? How do we educate incubators and accelerators? How do we educate investors? How do we educate policymakers? And then policy itself. How should these European, as a head of the American national systems of entrepreneurship, take this into consideration? How do we create innovation ecosystems that are emotionally intelligent? There's been a lot of work done on how to make innovation ecosystems that increase entrepreneurship rates and survival rates, but without taking a look at how to make them more emotionally intelligent. And then education and policy, health policy and mental health policy related to improving the likelihood that people will enter into self-employment and survive in self-employment. So that is the end of my slide presentation, and I look forward to answering some of your questions in our conversation. Thanks.
Thank you, Dr. Freeman. We've got a couple of questions for you, but we'll get back to those after we go through the rest of the speakers. Next, we'll turn the microphone over to Mr. Diego Mariscal.
Great. Well, thank you everybody for being here, and thank you for having me. Yeah, I'm glad you clarified that, because I wanted to make sure that people know I'm not a doctor, unlike most people in this panel. So just wanted to clarify that. Thank you everybody. So I'll start by, first of all, thank you, Micahel, for sharing that research. You know, I have been going to therapy for the past like 2 years, and it's really been a life-changing experience for me. And so I really appreciate, you know, what you said and what your research shows, because I've definitely found clinicians that are sort of unequipped and don't really know a lot about both entrepreneurship and my field of expertise, which is really disability. So I'll share a little bit about my story, and then hopefully we'll get to how it intersects to healthcare and entrepreneurship. So I was born in the States actually by accident. My parents are both Mexicans, and they were shopping for baby stuff. And I was born 6 months and a half into my mom's pregnancy. So pretty tiny baby. And as a result of that, I have CP, cerebral palsy. And, my parents, they didn't have insurance. So because they were Mexicans. And so they were kind of freaking out, like, how are we going to pay for all these expenses? And especially because I had to stay in an incubator, and they had a trip planned for 3 days that turned into 3 months. And so my dad had to go back and forth and figure out, how they were going to pay back and forth between Mexico and the States. My mom jokes and says that that's how he lost all his hair, because they didn't know how they were going to survive. But later, they found out, thanks to a social worker, that because I had stayed in the States for more than 3 months, and because I was a US citizen, health insurance would kick in. And so they were able, the government health insurance was able to cover all my expenses. So I like to joke and say that I was basically a free baby as compared to my brother, who was born in Mexico. But I share that experience because I think we were lucky in the sense that, I got adequate healthcare and adequate resources, especially early on. But this comes with a level of privilege that I think it's important to recognize. My parents, even though they were from Mexico, they were educated, they spoke English, they knew how to advocate for what they needed. They knew how to navigate complex systems of government. And that's not the case for many people, especially people with disabilities. The American Progress Center cited that 1 in 4 people with disabilities live below the poverty line, similar to what you were saying, Michael. And so, what's interesting is oftentimes you have this dichotomy of people with disabilities live below the poverty line and don't have adequate resources to just live a productive life. And at the same time, they're more prompt to complications, and they're more prompt to difficulties because they're not receiving adequate resources. And so there's this systemic issue that needs to be addressed. The other point that I think is really important to make is the distinction between the medical model in which we talk about disability and the social model that we talk about when we talk about disability. And Michael, I'm really glad that you brought up the neurodiverse term in the autistic community, because oftentimes when we talk about disability, the typical way of thinking is a disability something that has to be fixed or cured, and it's not seen as an identity component like we see race or gender or sexuality. And so thankfully, I've been lucky enough to work on disability advocacy, disability and entrepreneurship, and I have found a community of people that recognize disability as an identity, same way that we recognize other parts of diversity. And that's a very empowering place to be, because suddenly we're no longer suffering from a disability. We're managing a disability, and it can be used for innovation, creativity, resiliency. And in fact, much of the work that I do focuses on how do we take the experiences of a person with a disability. As people with disabilities, we have to solve problems every day. How do we get dressed? How do we drive? How do we communicate? And we translate those experiences into the entrepreneurship space. So by doing that, we change the way the individual views their own disability, and by default, change the way society views disability. And that's a very important distinction to make, because if the entrepreneur starts to see their disability as a competitive advantage, that also needs to be managed, and then needs to be properly supported, and then needs to be properly taken care of. You start to have this more realistic picture of both entrepreneurship, disability, and the healthcare space. So that's sort of my second proposition. And the third point I want to make is that specifically in the disability community, there's sort of a benefit that can also be a curse, in that as disabled people, we tend to have access to Medicaid, healthcare, but there's a cap on how much money you can make in order to receive those services. Most people that are on disability benefits can make, if they're making more than $2,000 a month, they're at risk of losing their benefits. And so that's an important systematic distinction to make, because oftentimes people don't want to work or don't want to pursue entrepreneurship because they're afraid of making those, of pushing that threshold. At the same time, we're in a lucky position because we have that medical coverage. Disabled people can take more risk in pursuing entrepreneurship because they'll be covered. They'll have this sort of initial coverage, right? That's granted just by having a disability. So it's important that we talk about both the systematic oppression and the systematic advantages that disabled people have in pursuit of entrepreneurship. So yeah, I'm excited to continue the discussion, but those were the 3 points I wanted to make for today.
Thank you so much, Diego. Next, we will turn the microphone over to Dr. JaNae Taylor.
Okay. Well, good morning, everyone. I bring you greetings from Virginia Beach, Virginia. My name is Dr. JaNae Taylor, and I am the owner and operator of Taylor Counseling and Consulting Services. I also am the founder of Minding My Black Business, which is a safe space for Black entrepreneurs to improve their mental health and check in on the mental health of other Black entrepreneurs. So we offer some digital programming, there's a podcast, there's resources. In addition to that, I also serve as the vice chair for our Black Chamber of Commerce here, that's entitled Black Brand. So I say all that to say that I am in the company of Black entrepreneurs the majority of my working day, and learn a lot of things as a result of not only being a part of that community, but being of service to that community. So I wanted to share some pieces, specifically the things that I've been learning in terms of my boots on the ground experience about what's happening for our Black entrepreneurs. So in general, Black entrepreneurs are dealing with what I like to call entrepreneurial anxiety, which is certainly some of the things that have already been discussed earlier in the panel and even the previous panel. And in fact, I've been doing head nods continuously as you all have talked, because I've been able to identify with some of the things that you all have mentioned. So I like to think of this state as being just kind of the overwhelmed, feeling stressed, that's connected to running of the business. And it's oftentimes closely associated with the finances of the business. So the unpredictability of it all, having a bad quarter, loss of funding, all of these things are unpredictable at times and can, spike someone's anxiety. I also am finding that our Black entrepreneurs are not doing the best job when it comes to self-care habits. And this was mentioned before in terms of sleep patterns. So the idea that someone needs to get 8 hours of sleep. When I say that to people in session, when I say that when I'm speaking, they laugh at me as if that is the funniest thing ever. And so just getting them to kind of integrate that into their psyche, that this is something that needs to happen. Not taking breaks throughout the day, not even having vacation time or sick leave. The idea of that as an entrepreneur is laughable, I'm getting from people. So let me give you a little bit of context. Here in my part of Virginia, so I'm in the Hampton Roads area, Virginia Beach area, about 90% of our Black businesses are small business owners. So they have less than 2 employees. So they tend to be from the CEO to the janitor as it relates to running their business, and tend to be quite overwhelmed and also very isolated. So that tends to be a large part of what we're talking about when they're in session. I happened to do a presentation early on in the pandemic, around about April, about how they can take care of their mental health. And we were in a different space. And I looked at it the other day to see what was I talking about? What was I saying? So some of the things that people were talking about at that time is that they were struggling with feeling displaced in their business. So maybe having to pivot. If I had a brick and mortar, then now I'm more online with my services because there's been the governor has shut it down. A loss of customers, if I'm a salon owner, well, I can no longer go into my salon. Having to have an increased digital presence, which has also changed my business model, which in some ways might work to my skill set or other ways might be to my detriment. Feeling the isolation, not just because I'm a small business owner, but because I'm isolated literally in terms of the social distancing and being shut in, or being shut in with my loved ones, which is creating a whole nother set of circumstances. Now everybody's working from home. Children are working from home as well in terms of doing their schooling. And that's creating a level of tension, to use it nicely. And so then in thinking about and preparing for this panel, that was 7 weeks in, and now 7 months in, where are we? Some of these things certainly still remain, but there are now additional pressures that are happening for us. And one of those things that I haven't heard just yet is the long-term effects of the trauma that we are managing. So not only the kind of pandemic fatigue, so the exhaustion of the unknown, the uncertainty, when we sort of get back to what feels like a more regular life, but also the fatigue of being exposed to this systematic, the race-based trauma, to be quite honest. So not only the incidence of police brutality, but the response of people as it relates to Black Lives Matter. There's like a visceral response when those words come up, and what it means to be a Black entrepreneur and how that might impact your business. Well, what do I do? Do I protest? Do I not protest? If I choose not to protest, for some people, the protest is actually keeping my business open. To be a Black entrepreneur means that I need to do an even better job about managing my funds. And so now we're also on the cusp of seasonal depression disorder as it relates to all this fatigue. And so in thinking about all these different balls that Black entrepreneurs are juggling, it might feel like all is lost. And so how have we been making it, really, is the question. And the first answer is we have been very creative and gone to some of the cultural structures of leaning on each other and really kind of connecting with the collective. And so a lot of that has been kind of assessing support systems. And so I spend a lot of time and talking with my clients, or even when I'm doing consulting, talking to them about that, because people who have traditionally been a part of your support systems assess that. Maybe they can continue to be a part, or maybe they no longer need to be a part of your support system. And then the second is reestablishing boundaries. We've heard before about how entrepreneurs in general kind of struggle with their relationships with their businesses, and the lack of sleep, the kind of what I hear often, kind of the hustle or the grind culture, that I'll kind of sacrifice myself, my body, for my business. And oftentimes that's born out of not really having access to capital. Then we also don't have, that many employees. So truly, any waking moment I have, I need to be working the business. So we talk about reestablishing those boundaries as it relates to that. Being very open about your concern, because that's the other part too. Because oftentimes Black entrepreneurs are seen as pillars of the community, leaders of the community, and therefore should be problem-free. Well, that within itself puts you in a box that's kind of impossible. So being open with your concerns and being in fellowship and community with other Black entrepreneurs can be very helpful too. And of course, I, as biased as I am, seeking out therapy in the ways that you can. And so in the ways that I am being helpful in those ways is, I do have my practice, but I do have these other spaces in which I can connect with Black entrepreneurs who might not necessarily need therapy, but might need just some resources or some psychoeducational information about how to kind of best maintain. And then, any ways that I can provide in terms of my connection to the Black Chamber of Commerce about access to funding, or even skills about business planning, those sorts of things. So in a space like this, I feel like it's important for me to say, how can you all be helpful to Black entrepreneurs? Because we certainly would benefit from your support. The first things first, it seems like a very therapist thing to say, is check in on a Black entrepreneur. If you know one, check in, even if it's simple, it's how are you? If you don't, then it's now time to find an entrepreneur. It's time to find one that's around you in your community, small business owner. Support their content as you create your own services as it relates to Black entrepreneurs. As you do your own research on entrepreneurs, don't forget to create space for those racial dynamics. So that we can further learn more on a grander scale about how Black entrepreneurs are being impacted. But that concludes my remarks, and I so look forward to this conversation.
Thank you, Dr. Taylor. So for this next portion, we're going to take questions from the Q&A. So if you haven't posed your burning questions, go ahead and type them in there. This first question I'm going to ask to all of our roundtable participants. I think in consulting, we talk a lot about what does the future state look like? In this instance, I want to talk about if you had a magic wand, what changes would you make to the healthcare system that would help make it better for entrepreneurs? And this question is from Dr. Gish, so thank you for asking it, but we'll just go around the horn and get your thoughts.
So I can start, since I started the horn, if you will. My magic wand I'm so passionate about decoupling insurance from employment, and as specifically with respect to encouraging entrepreneurship. So if the barrier to entering an entrepreneurial role was lowered because people weren't beholden to these benefits, if you will, that their current employer has, we would see a lot more people in entrepreneurship. And I can go on and on and on about why these benefits exist. But one story that I'll share with you all, and I think I'm preaching to the choir considering this is a group of entrepreneurs that we're talking with, but I was talking to a mentor and a colleague, and he has a much more affluent career than I do, I will say. And he was hiring somebody into the C-suite of this organization where the compensation was going to be seven figures plus. And as part of the negotiation for this job, that prospective employee was negotiating with my mentor and saying, all right, here's the salary, et cetera, but what's my health, what am I going to get for health insurance? And if somebody who's being paid seven figures is that worried about access to healthcare through their employer because the open market doesn't exist for that person who has an incredible amount of financial flexibility, we have a huge problem. That is a huge problem. And so I think it really plainly illustrates that if somebody who's incredibly financially wealthy is having that, how do I get access to healthcare? How do I get access to health insurance conundrum? How does the person who is going out on a limb, extending their family, extending themselves into 6-7 figures of debt to start a new business, how is that person conceptualizing the potential of spending, $12,000 to $20,000 in premiums in a year for their family? We need an accessible, operational sort of a marketplace that any individual can enter into that is actually affordable and competitive. So that would be my magic wand.
I'll take a shot at that. It's not hard to figure out where to start. First, there needs to be universal coverage for affordable, appropriate, and effective healthcare, including mental health and addiction treatment. I don't think that can be achieved with the American system of healthcare financing. And so, like Dr. Edwards said, if you look around the world, the solutions that work in country after country after country are all based on a single payer model. So some kind of a single payer model, universal coverage, it's the Medicare for all kind of concept. Within that, mental health has to be covered at parity with other healthcare issues and conditions, and that would include addiction as well. And then the third point is that we need to shift where we're investing. Right now in the United States, our healthcare system allocates more money for the last 12 months of life than we do for the first 12 years of life. And that is the result of these crazy financial incentives that are designed to make healthcare profitable, but not effective. And so the net output of the American healthcare system is illness treatment services, rather what the output should be is health. So redirecting our healthcare system to produce health as an outcome is going to require that we invest in prevention and that we invest in promotion. And that also applies to mental health prevention and mental health promotion. As it applies to entrepreneurs, that can be done starting at day one of opening a business or before. What we know from longitudinal studies of children with ADHD is that they are significantly more likely to become self-employed than other kids. And yet those children with ADHD and the rule breakers and the troublemakers who are getting kicked out of schools, who are going to go on to be the B students that hire the A students, don't have the supports that they need at the time that they really need it. And so now when they become entrepreneurs as adults, they have these massive self-esteem issues that result from having been kind of beaten up as kids because the schools have teaching disabilities and the healthcare has a healthcare service delivery model that's defective. So that would be my magic wand.
Okay, so I can take a stab at this. So I think from the policy standpoint, I think people kind of hit the nail on the head. I think where I can contribute the most, and just based on my own experience, is primarily on the advocacy perspective and on the how do we look at disability and sort of medical model perspective. Meaning that there's a lot of power in people sharing their disabilities, their struggles, their mental health journey. I was leading a group that had nothing to do with disability, but because I bring disability into the conversation, suddenly everybody in the room, and there were about 7 of us, everybody in the room started to come out as having a disability, whether it was depression or ADHD or some sort of invisible disability. And that's because the stigma was reduced. And so if nothing else, from an advocacy perspective, I would encourage people to just talk about their disability, talk about their, even if you don't call it disability, talk about your struggles, and that will make you feel better and more people around you more comfortable and honest about what supports they really need. So.
Oh my goodness, I agree with all those things. And the piece that I would add as both a therapist and an entrepreneur is certainly connected to insurance and specifically the reimbursement rates as it relates for mental health therapists. Because what I'm finding is, as a result, a lot of my colleagues are and myself included, have decided to disconnect from certain insurance panels because the payback is so low. There was a point last year when I got a check for $5.38. And so it was at that moment that it was clear that I needed to no longer be in that insurance panel. But that's a real struggle in terms of someone's insurance changing. So I've had that where my clients were with one insurance, that is my favorite. And then all of a sudden their company has now changed, or they've decided to change insurance panels. And I'm no longer paneled with them. And so now they have to make decisions around how to use their out-of-network benefits. Are they going to use flex spending? What am I going to do? Are we going to kind of make an agreement around that? So it puts me in a space that's so very uncomfortable as both a therapist and an entrepreneur. Do I try, is their health, is their mental health more important than my mental health, frankly, because I don't work for free, nor should I. And so for me, it's really the way in which insurance values mental health and how much they are paying those who are providing those services. It's abysmal.
Can I follow up, Dr. Taylor, on that point? Because I think it's a really important point. So Dr. Taylor just laid out that as an entrepreneur, she ultimately is responsible for her P&L, and she has to be compensated for her work, and she should be compensated well, and we should value mental health care, right? But then in the same breath, she says, however, the obstacle is insurance. And I want to take it back to what Dr. Freeman says, where he's like, well, insurance for everybody. And so this isn't a clear linear sort of solution, like everybody gets insurance, problem solved. That's absolutely not it. It needs to be a dynamic solution where, when Dr. Taylor evaluates that an insurance company does not value her services, that she can also elect to still pay her own bills and charge an adequate market rate without getting an insurance company involved, which is my bias, obviously, since we've sort of ditched insurance in our model. But insurance also makes things way more expensive because of the administrative costs. So while I value a single payer system or a Medicare for all system, because I really want everybody to have a backstop, we should not be declaring bankruptcy because of catastrophic illness. That is just inhumane in a wealthy society like ours. We also need to be able to have the agility and the infrastructure in place so that people can have a dynamic marketplace to actually shop around for transparently priced, cash-based medical services and mental health services. Like, both of these things need to exist and be accessible. Okay, that's my rant.
It's a great rant, and you've gotten some questions here, Dr. Edwards, about your model and the way that you've set it up. And if there are communities of providers like you, or are you a part of a movement? Are there others that are doing this, or are you, a unique special flower who's kind of charging the way? Can you tell us a little bit more?
Yeah, absolutely. I think there's a quote that's attributed to Picasso, but Picasso probably didn't say it. That's, good artists copy, great artists steal. And so I am not going to be above saying that this model, when I first heard about it, was certainly not something I invented. There are incredible mentors and trailblazers out there who, trailblazing is such a funny thing because ultimately paying directly for your health care is kind of what happened 2 or 3 generations ago. So there are a lot of doctors out there. The resources I can give to you all there are a couple of lists of people who do what's called direct primary care, which is how I operate. One of them is through the mapper on dpcfrontier.com. This is a guy who has a hobby. He just kind of collects resources. I am in no way affiliated with them from a financial standpoint. And then the other one is the Direct Primary Care Alliance. And so those are the 2 organizations that I constantly am looking to for guidance on how to better operate my clinic from an entrepreneurial standpoint, but also where I refer people nationwide who are interested in getting access to care like this. So it's good to have mentors and it's good to have support people in entrepreneurship.
Very cool. Our next question is a little bit different, and it's coming from the perspective of an incubator and accelerator as, a source of providing services to entrepreneurs. And the question is, what types of services when it comes to healthcare and information and support to entrepreneurs, especially Black women entrepreneurs, should they be looking to provide, and how can they be a source of support? If you guys have ideas about how that could fit in.
I'd love to take a shot at that question. And whoever asked that question, just feel free to reach out to me we can talk more about it. But what we're trying to do is to create a resource that can be kind of a shared mental health resource for incubators and accelerators so that everyone doesn't have to reinvent their own. And we're in the early stage of doing that. We're getting some traction, which is great. As it pertains to resources for Black entrepreneurs or older entrepreneurs or women entrepreneurs, we're going to need resources to invest in developing that level of specificity of emotional supports. But where we're starting is by creating emotional supports for all entrepreneurs, and it has to do with things that you heard about in the first panel: life cycle, management, and sleep-wake regularity, and resilience, and stress and coping skills, social skills, recognizing mental health symptoms, how to ask for help, prevention, self-care, social support, nutrition, basic wellness kinds of things. There's a lot that can be done, and it doesn't have to be that expensive for people at the incubator and accelerator stage. And that's a very, very important stage, I believe, for intervention, because it's about prevention. You know what I said in my prior comment about put the money at the beginning of the curve. There's something called the morbidity curve, which is like, where in your life cycle do people experience illness and symptoms and disability and ultimately death? And how do you allocate resources against the morbidity curve? And the best outcomes are achieved when you put the resources in the beginning, and that's incubators and accelerators. So that's what we're trying to do. And I'd be happy to share more about that with anybody individually offline.
All right. We've got just a couple minutes left here. Our last question, I'm just scrolling through. Does anyone have any other, while we're looking here, does anyone have any other thoughts on how incubators and accelerators can help? They specifically asked about supporting Black women. So Dr. Taylor, I don't know if you have any thoughts there.
Right. So I did catch that.
Okay.
So my original thought is one of the things that the Black Chamber of Commerce has done here is connected with, there's a 757 Angel investor group. There's an entrepreneurship program at one of the local universities, Old Dominion University. And so they've made partnerships with them as well to provide support to get people prepared to even apply to angel investing and pitch contests and all these things. So I think as it relates to that, having Black entrepreneurs get connected to their Chamber of Commerce is going to be really, really helpful. If there's a Black Chamber of Commerce, even better, because there's not only do we bring up issues connected to building your business and writing a business plan, but it is these pieces around access to capital, business development, and then this other layer of local political things that could impact us as well, and having these conversations about how we're being impacted as it relates to racial injustice. And so for me, that's been really fulfilling to be in that space, to sit among all that intersectionality, because just running my business or trying to figure out how to pay my rent is just one little slice of what I'm having to do as it relates to maintaining my business.
Nice.
I'd like to just add one comment on what Dr. Taylor said. And Dr. Taylor, I think I really appreciate your contributions, both what you're doing in your community and also on this panel. A couple things that you said really resonated with me to the point that I wrote them down. One is you said, connect with the collective. And the other thing that you said is be in fellowship with your community. And to my way of thinking, what you're talking about here is peer support. And what I'd like to do is connect this idea of peer support to one other little known fact about Dr. Taylor, which is that if you go on her website, the first thing it says is not accepting new clients. And I'm not accepting new clients either. I'll tell you, there's a lot of them and very few of us, and we cannot meet the needs, the emotional and mental health needs of the entrepreneurs that are out there. There's just a huge shortage of therapists. So figuring out ways to create peer support channels which are scalable, I think is part of the solution. And I just want to kind of recognize you for bringing that into the conversation.
Very cool.
I want to add one more thing. Thank you for that, Dr. Freeman. You're right. I'm not accepting new clients, and at the same time, producing all these other spaces. So the podcast, go there. Those digital resources, go there. But you're right. In terms of the clinical work, you have to create a cap on it. You have to have those healthy boundaries with it. And so I'm trying to practice what I preach.
All right. You guys are getting the hook, but if you want more Dr. Taylor, you can find her on the internet at her podcast. But this has been really fun. And thank you guys. Thank you for inviting us to join. We are now going to pivot to the next panel. And we'll turn the microphone off over. Our microphone's turning off, but we're going to push it over to Dr. Young Min Lee. Thank you.
Thanks, Brooke. Hello, everyone. Thanks for joining the panel too. What does research tell us about healthcare access for entrepreneurs? Thank you to all our participants as well as our speakers. I also would like to thank the Kauffman Foundation for organizing this forum. Health and healthcare access for entrepreneurs is a very important topic, particularly more in the current COVID-19 pandemic situation. Entrepreneurship is a key for innovation, job creation, and economic growth. But under this unprecedented pandemic situation, entrepreneurs face with a higher health risk and limited access to healthcare, in addition to financial hardship. This forum, I think, gives a great opportunity to learn about the health and healthcare access for entrepreneurship. By the way, my name is Kyung Lee. I'm a junior professional officer at the World Bank Group. I'm a moderator for this panel. And in this panel, we're going to focus on the research on healthcare access for entrepreneurs. We have 4 great panelists for this topic. Each panelist will get 7 minutes to present their prepared remarks. Then I will open the floor for group discussion and Q&A. Before joining the bank, I did my dissertation research on the impact of the access to health insurance on entrepreneurship. And during my research, I learned a lot from our panelists' research. So I'm looking forward to learning more from this panel discussion. And I'm very happy to introduce our panelists. First, we have Dr. James Bailey, Assistant Professor at Providence College. Second panelist will be Dr. Angieszka Kwapisz, Associate Professor at Jake Jeffs College of Business and Entrepreneurship at Montana State University. Then we have Matthew Ray, the Associate Director for the program on the healthcare marketplace at the Kaiser Family Foundation. And our last panelist is Dr. Kosali Simon, who is the Herman B. Well Endowed Professor and Associate Vice Provost for Health Sciences at SPIA at Indiana University. Now I would like to pass on to James for his presentation.
Thank you. I'll try to share some slides here. All right, hopefully that's working. Yeah, so I want to focus today on the connection between health insurance and entrepreneurship. Something I and I think a lot of the panelists have thought a lot about, and I want to focus in particular on 2 questions. First being, do entrepreneurs have a harder time than employees in getting access to health insurance? And I think the answer there is a clear yes. Probably not going to surprise anybody here, either as a researcher or as an entrepreneur. And then 2, to what extent does this difficulty in getting access to cheap, or good health insurance, to what extent does that deter many potential entrepreneurs? That's a little bit harder, but I think, we can be pretty sure that a lot of people are being deterred by this difficulty. So just to, throw some data out there on the first question, it seems obvious, but not to take it completely for granted. If you look at the proportion of self-employed people versus employed people who have private insurance where they're the policyholder, right, you can see it's much more likely if you're an employee that you're going to get private health insurance in your own name. It's fluctuated over time, but you can see that for the most part, things have actually been getting a little bit worse for people who are self-employed. There's a bit of a bounce back with the Affordable Care Act in 2014. But people who are self-employed are about 15 percentage points less likely to have private health insurance in their own name. Now, they make up for some of this by getting health insurance through their spouses or through government programs, but not entirely, right? And so if you look at the uninsured rate, that's also tends to be substantially higher for the uninsured, for the self-employed. And it's, this gap, this level of uninsurance fell somewhat with the Affordable Care Act, but that's true for people who are employed as well. And so this gap very much remains, where it's harder, seems to be harder to get access to health insurance as someone who's self-employed. So returning to the second question that's somewhat more difficult is, to what extent does this deter people from going into entrepreneurship or self-employment? Because you might think, well, somebody who wants to be an entrepreneur, they're a risk taker already, right? And so maybe this is one more risk that they'll be willing to run. And clearly a lot of people are willing to run that risk, as you can see, because, I showed you how a lot of people are self-employed and uninsured, and they're just dealing with the risk. But when we look to the data, we tend to see that there are a lot of other people who would like to be self-employed, but aren't as a result of these concerns about health insurance. Now, I'm going to try to, this is maybe too abstract and everything, but just when we're trying to figure this out, there are a few different research strategies that we can use. And some of them are better for getting a very confident assessment that we've figured out what's going on, right? They're better for getting at the truth. And others are better for getting at things that are important if they're true, but we're a little bit less certain whether or not they're true. I'll just go on to think about what that means in this case, right? So the core difficulty is, we want to know, are people deterred by the sort of employer-based health insurance system from going to become self-employed? And we want to understand that, we want to find variation in times where it became easier or harder to get access to non-employer health insurance. And ideally, we want to have a control group to study, right? Where, did it become easier to get non-employer health insurance for some people, but not others? And then we can compare who goes out and starts more businesses as a result, right? And the sort of neatest way to do this, where we can be pretty confident about our results, is where we're studying program expansions, especially if they do affect some groups more than others. And so a couple of the big program differences that have been studied are the gradual expansion of the tax deductibility of health insurance for self-employed people. So it used to be that only big employers could do this. Increasingly from 1986 to the early 2000s, this became available for self-employed people as well. And then the Affordable Care Act, also a bit of this with HIPAA, right? But just to sort of quickly summarize some of this research, as far as I can tell, all the research on the expansion of the tax deductibility of health insurance says that it did lead to some moderate increases in the rates of self-employment. The ACA, the Affordable Care Act research, is a little bit more mixed, where you do have a lot of research, finding some increases in entrepreneurship rates, but it tends to just be for very specific subgroups. Now, with some of this research, it's looking for an overall impact and not finding one. Others, they're just not looking for it. They're only looking at one specific subgroup, and they are finding it there. But just some of the places that have been spotlighted with the Affordable Care Act would be So I looked into the dependent coverage mandate that lets young adults stay on their parents' insurance. So again, not as tied to employment. And I looked to see if that increased the rates of self-employment. And it only seemed to for young adults who had a work-related disability. And so maybe sort of cared more about health insurance as a result. There seems to have been an increase for people who were eligible for some of the ACA subsidies. For older adults, perhaps I'll talk about that strategy in a minute if I have time. Perhaps for young men, in a paper co-authored by one of our other panelists, and then likewise perhaps for Medicaid recipients in a paper written by our moderator. But overall, I'd say the research here is mixed. We're definitely finding things for some subgroups, maybe not for others. I think the problem with all of this research, my own very much included, right, is that it's almost necessarily backward looking, right, where we're looking at these previous programs that have been put in place, and we're figuring out, I think, pretty confidently what they did. But I think that tells us less going forward about like, to what extent is there still this entrepreneurship block where people are afraid to go start a business because it will mean leaving their employer-based health insurance? So how much of that remains and what new policies might reduce it? That's a lot harder to say with these really clean research strategies. And so for the most part, economists haven't been trying. Again, mostly myself included. But I was trying to think more, looking at the present or perhaps looking forward, what could we say here? And so, one of the older strategies from some of the papers in this field was just to compare people who have whose spouse has coverage that covers the whole family to those who don't. And so I looked at the result of that over time, just controlling for a whole host of other variables. How much more likely are you to be self-employed if you have that family coverage coming from your spouse than if you don't? And that's been a fairly consistent 3 percentage points over time. And the base rate of self-employment here is about 10%. So this is a pretty substantial, about 30% more likely to be self-employed if you have family coverage. One of the other gaps that another paper, Fairley, Kapoor, and Gates first started looking at, and then I've studied since, is what happens when people get on Medicare. Because what that earlier 2011 paper identified is that basically as soon as people turn 65, there's this huge jump up in self-employment, which they attribute to getting access to Medicare, again, health insurance that's not tied to your individual employment. And so I've looked at this gap over time, right? So what's the self-employment rate among people who are 65 to 69 and so presumably do have access to Medicare versus people who are in their early 60s and so presumably don't. And again, that gap has been fairly consistent with time. It narrows a little bit with the Affordable Care Act in 2014, where some of these people in their early 60s are getting access to some cheaper non-employer health insurance, but it's still very much there. And so just, trying to conclude overall and not go over my time. I think with a few of these measures, again, I think none of this really like nails it, because you can always say like, well, things are different about people in the early 60s compared to the late 60s, which is true. Things are different. There's just other things that are different about people whose spouses can give them health insurance versus those who can't. And that's all true. So I don't, this isn't as certain as some of that other program evaluation research, but at the same time, I think the right ballpark to look at is to say that if non-employer-based health insurance were cheaply and easily available to everyone, self-employment would be up to about 30% higher than it is today, which would mean going from about 10% of the workforce up to about 13%. So thanks.
Thanks, James, for the nice presentation. Now I pass on to Angieszka.
Okay, so quickly, I want to talk about health insurance coverage and how it depends on the gender of the entrepreneur and on the sources of the information they use. So let me go on. And James covered a lot of my first slides, so let me skip over a few of those. Let's go to the next one and maybe next one. And one more. Sorry, because I'm not using my own. And this is what James talked about ACA and how how health insurance coverage affects lock effect. And let's go to the next slide. But many self-employed still opt out not to be covered by insurance. And let's go to next. And what I ask is, does this depend on the gender of entrepreneurs, and why would it be dependent? So let's think about this. And there are several reasons why female entrepreneurs may not be covered as much as male entrepreneurs. And we talked a little bit about this before in previous presentations. In first panel, we know that women start their startups with less money, with some research even shows with half the capital than men. We know that women face higher barriers in obtaining the finance. They also start in industries that may be less profitable. And they start smaller companies too with fewer employees. So they may have higher cost of providing the insurance to their employees. So let's go to next. But however, on the other side, on the demand side, women actually may demand more services than male entrepreneurs because of they were found to use more benefits such as, of course, pregnancy, childbirth, birth control, mental health, and preventive care services. And research shows that female would use those more often. So if we go to the next slide, if you go to the right, interestingly, even something that shouldn't be happening, but even after the introduction of the ACA, eHealth reported that monthly premium for female entrepreneurs were higher than for male entrepreneurs. So that's we also see. And now if we look at the research on the next slide, is there any evidence that health insurance affect the self-employed woman? And the answer is it's a little mixed, but yes, there is. We saw increase of self-employment among single women after the tax reform in '86. And we saw some increases, larger increases for women after the ACA. So there is some research there that may show that there are differences between health insurance women and men. So let's go to next. We also know that female entrepreneurs have different networks, and there is research on showing that female entrepreneurs networks are less likely to include professionals, other entrepreneurs, powerful actors, investors, people of influence. We also know that they rely more strongly on strong ties of family and friends. We see that the female entrepreneurs are more likely to join female-only businesses, business associations or clubs. So those networks for male and female entrepreneurs are different. So let's go to the next one and skip this one. And these are the results that I've seen after studying the subject. Of course, I see that the odds of being covered by health insurance for self-employed are lower, even after, this is for the year where the ACA was in full swing, full coverage of ACA. What I also saw that in general population, the odds of coverage for females were, female entrepreneurs were covered, the odds of being covered by health insurance was much less than for males. Now, this is in contrast to general population. In general population, we see the totally opposite. In general population, we see that females are actually more likely to be covered by health insurance. So this is just for female entrepreneurs. And like I said, the reason may be that they don't have money. The reason it may be that these are females who go into entrepreneurs who can accept more risk. We don't know, my research doesn't show why, but we can speculate on this. So if we go to the next slide, I want to see that there is something very interesting, that being covered by insurance for females depends on the source of the advice. When I've looked in my sample for females who looked for advice from financial planners, all of those female entrepreneurs were covered by health insurance. But those who rely on family and friends, and actually different source was internet, were much less likely to be covered by the health insurance. So the source of advice really matter for female entrepreneurs. So if we go to the next slide, some conclusions for self-employed women, in particular, for self-employed and particularly self-employed women, they need to evaluate the risk of health insurance. Medical debt is one of the is the main reason for bankruptcy, and being not insured puts those female entrepreneurs at greater risk of bankruptcy. Let's go next. For governments and policymakers, whatever we do for female to make the health insurance more available will be especially important for female entrepreneurs. And then we go to next. From my results of financial advice, it looks like providing free or cheap financial advising may be very beneficial public policy. And then we go next. So this local, state, and national government should not underestimate this benefits of reaching out to entrepreneurs and explaining those benefits. And then for incubators and accelerators, in my previous research, I've seen that women entrepreneurs demand different things from accelerators. They demand more of transfer benefits, of knowledge transfer benefits, of how to. And that may be actually a good opportunity for incubators and accelerators to point to the importance of health insurance for entrepreneurs. And one more thing, the next slide. Sorry, I already talked about this one. Let's go to next. For the public debate on the health insurance, we know that the women's self-employment is on the rise. If women entrepreneurs chose not to be insured, that may actually increase the number of uninsured entrepreneurs. So that may be what we can see later. And I will finish with the last slide. That I like the quote that good health is essential to run a business, and running a business may lead to success in good health. That's all my presentation. Sorry for my trouble with the internet. It didn't play out the way I wanted.
Thanks, Angieszka. Now I would like to pass the mic on to Matt.
So my name is Matthew Ray. I'm the Associate Director for the Healthcare Marketplace at the Kaiser Family Foundation. We try to provide nonpartisan, informative, useful data on how the healthcare system is working, mostly around how it affects everyday people and consumers. The Marketplace project looks specifically at private insurance. So I spent all day thinking about private coverage. And I think one of the big things we do every year is the employer health benefit survey. So I was hoping to give a couple slides from that as context of what's going on in the small group market. So we have this weird healthcare system in America where health insurance coverage is tied to employment. And that means the self-employed live in this kind of weird space where they're somewhere in between the non-group market, where they get individual health insurance, which has all these market problems or market challenges, and the employer market. So I know Dr. Simon is going to talk a little bit more about the non-group market after this. So hopefully this helps give the other part of the picture. What we do every year is we call as many employers as we can possibly get on the phone and do a probability sample. where we ask about all the detailed benefits of what employer coverage looks like. And we just released the 2020 survey. So I want to give I think the 4 big numbers that affect small firms and where small firms really look different in the type of employer coverage they offer, given that some self-employed people are in the employer market and others aren't. And some are in the employer market as sponsoring the health insurance policy for them and their employees, and some are there as dependents on another person's policy. As we know, the self-employed tend to get coverage from a lot of different places. So the big thing about health insurance coverage for small firms is not very many of them offer it. So about 53% of the smallest firms offer health insurance. Virtually every large employer of the biggest employers in the country offer health insurance to at least some employees. The percent of large employers who offer health benefits has been relatively stable over the last 20 years or so. But among small firms, we have seen sort of a precipitous decline. I would say it's been steady. It has over the last 20 years, but now only about half do. So among the firms that don't offer health benefits, a huge share of them just tell us, not surprisingly, cost is the reason why. There is a meaningful share of those small employers say they don't offer benefits now because they think their employees can get coverage at a better deal somewhere else, which may speak to sort of how the ACA is sort of filling in some of the gaps for these hard to insure groups. The other thing that among those firms that don't offer health benefits or sponsor health insurance policy, a big chunk of them, about 8% of them, provide funds for employees to purchase coverage on their own in the non-group or the individual insurance market, which hasn't really grown over time, but there is interest in the administration about providing new financial arrangements that would help employers move more people into non-group coverage by allowing them to use pre-tax dollars to purchase non-group policies. So this slide is not from the employer survey, but it's from a project we do with the Peterson Foundation, looking at all sorts of things on the healthcare system. So I recommend anybody check out either KFF or Peterson site. So this actually perfectly complements what Dr. Bailey had shown at the top, is we know that self-employed people, for both self-employed and employer coverage, has sort of declined over time. Sorry. So fewer people are on employer insurance now than 20 years ago. Employer insurance is still the majority of coverage in America. We know that much fewer self-employed people are covered by an employer plan. Partially, we saw sort of a decrease in employer coverage for the self-employed following the passage of the ACA and this increase in non-group coverage. The other way that we see this variation in who's covered by employer coverage is around income, which makes sense. So we see almost no decrease in the percent of people who are in the wealthier households and they're covered by being covered by an employer plan. We've seen this sort of precipitous decrease for this group, the 100 to 250% of the federal poverty line. We've seen a decrease from 1998 to 2018 for the share of these people who are enrolled in an employer plan. So flipping back and looking at what health insurance looks like for small firms, surprising literally nobody, health insurance is really, really expensive. So for an employer to sponsor a health insurance plan for a small firm, which is this bar for single coverage, to enroll one person is $7,500. And then the employer to cover their share of the premium chips in $6,200, or I guess that's closer to $6,300. The cost is obviously a lot higher for family coverage. So $20,000 or well north of $20,000 is the premium for one family on an employer plan that a small firm offers. The small firm premiums are cheaper on average than the large firm premiums. Bunch of reasons why, it probably varies, but we know that on average, probably the small firm plans are less generous. There may be differences in networks and other things. This number, this $20,000 number, that's the cost that the employer and employee together have to spend every year to keep someone enrolled. So obviously this is a massive expense for employers, with employers chipping in $13,000 of that. So one of the ways that small firms really vary in the way they think about health benefits from large employers is in terms of how they think about the contribution. So I just showed you that on average, workers are chipping in almost $7,000 to enroll in family coverage at a small firm. What many small employers do is that they make a relatively large contribution for single coverage and then almost no contribution for family coverage. So I'm pointing towards this 27 number here. So you can see small firms and single coverage, 27% of them pay the entire premium for the workers. The worker can enroll for no additional premium contribution, which is obviously a lot more than at large firms. But conversely, to enroll in family coverage among small firms, almost 3 in 10 ask the worker to contribute more than half the premium. So workers are, in those cases, chipping in well north of $10,000 to enroll a family. So this has big consequences for what dependent coverage looks like for workers at small firms. And I think part of this is that small firms are part of the way small firms think about it is they're making the same dollar contribution, or they may be making the same dollar contribution for workers, regardless of whether that worker decides to enroll in a single coverage or in family coverage, in part to maybe control costs or have more predictable costs. And then the last slide in the employer survey that I wanted to highlight was around deductibles. So obviously deductibles have just sort of gone up over time. Since 2006, they've sort of just skyrocketed. I think that, if I remember correctly, it's 110% increase in the average deductible. So this is the amount of money that a worker is going to come up with before the plan will pay for most services. So this is obviously a huge financial expense when people need to use services. So the average deductible for all workers is $1,600. But the average deductible for workers at large firms is a lot smaller. It's about $1,400, and then about $2,300 at small firms. So this difference has sort of been growing over time, I would say. And I think this kind of gets to this issue of affordability for the coverage being offered by small employers. So obviously, $2,300 is a lot of money to meet up front, and this is just for single coverage. For those enrolled in family coverage, and you've got to meet multiple deductibles. If you have multiple family members who incurred health spending in the year, provides a significant challenge. So that's a sort of a challenge for small employers going forward. So those were the things I wanted to hit from the employer survey. Happy to talk more about this and as we go forward.
Thanks, Matthew, for really nice, interesting presentation. So now I pass the mic on to Kosali.
Thank you very much. I'm going to my screen share, and you'll see that I'm actually going to continue talking about some of these themes because I'm going to talk about what it is that with health insurance being as expensive as it is, and also the institutional structures of health insurance markets, why those who are self-employed or entrepreneurs who have employees but are small firms have difficulty. And I'm going to focus on the individual health insurance market. So while Matt focused on the small employer market, and I think about taking it even one scale down to individuals purchasing health insurance and the particular difficulties they face. And I'm going to start off, though, talking about the cost of health insurance. So for that, I'm actually going to use some of the Kaiser Foundation slides because the survey does such a good job of giving us a view of what's happening. So this is thinking about the really long time period from 1999 onwards. You can see it's quite a pattern of just increased growth in premiums for single coverage, for family coverage. This is among all employers. So health insurance is very expensive, even when purchased through the average employer. Even when there are deductibles, even when there are networks, even though this is not what one would call first dollar coverage that covers just everything that might be, right? But still, there's also the fact that it has been growing so much faster than earnings. So we can see here that deductibles in particular have been growing, but just think about the dark blue line, workers' earnings and premiums. This is all really, really growing in expense, even when purchased through the average employer. And the average employer, average number of workers that an employer has, most are large firms. So thinking about this, here's what the individual market, particularly pre-Affordable Care Act, might be thought of. So there are, let's say, 3 buckets of problems, and they interrelate. So when you are on your own buying health insurance, suppose you're thinking about an entrepreneur who has not thought about starting on a large scale, thinking just for themselves and their family first. They're entering pre-Affordable Care Act, this individual health insurance market, which would look at these individuals purchasing health insurance, wondering, okay, so few people are participating in this market that there's generally a fear of adverse selection, that given what I'll get to as a third item, given the high cost of health insurance for individual purchases, those who are purchasing, we think in economic terms, tend to be those who have a higher demand, and you have a higher demand, higher willingness to pay, often when you know you're going to be needing these services, and therefore that means there's adverse selection. So adverse selection then leads this market, pre-Affordable Care Act, to have developed in a way that focused on providing what were known as, sort of low coverage plans, skimpy plans, because what do? You're trying to make sure that the self-selection works in the favor of you getting as healthy a population as possible, that those who have many pre-existing conditions or know they're going to be needing health care are going to try and stay away from those plans, or somehow you're designing them so that even if they do purchase, many of the things will be carved out. There will be high deductibles on particular services, or you'll have narrow networks. So the plans are going to be designed in a way that just discourage selection into the plans and also discourage high use, so skimpy plans. And then the other word that was in vogue in these markets is cream skimming. You're trying to get in this way the healthiest population. So why are you doing that? Because of the fear of adverse selection in unregulated markets like this, or in markets where there isn't a way to be able to know what the healthcare use might be. So it leads then to very high premiums. And although there was a change in the tax provisions, certainly before that, self-employed individuals also did not have the tax advantage. But to this day, if you are not purchasing it as a self-employed person, but are just purchasing it as an individual market customer, you do not get the tax advantage. And that can mean, a difference of like a third of the price and so on. So that leads to higher premiums, and that leads to this increased adverse selection. So I'm going to tell you again, sticking with, to be able to know how much the Affordable Care Act changed the scenario, let's look at 2013 health insurance plans. And ehealthinsurance.com was one of the places where people would go to. There weren't that many places, and there wasn't high use of this because people were mostly going through brokers to purchase individual coverage for entrepreneurs. What you'll notice here is that there is the amount of the deductible is pretty high compared to what we saw were deductibles in that same time period. So in 2013, the average deductible for employer coverage, $883. And then you look at what it is in the individual market, it's so much higher. But there are many other ways we're not even getting to see. The plan generosity is a hard thing to measure. There are some ways of actuarially calculating, but even that, you don't know quite how to factor in a narrow network. How does leaving out a really high cost provider, affect actuarial costs? It's hard to do. So here's one way, though, to illustrate the way that these plans were designed to really not cover a lot of things. In the individual market, this is the same survey, the same report by ehealthinsurance.com of the 2013 plans. There were about 80% of the plans on the individual market, and even of the plans that are family policies that did not cover maternity benefits. So this is an example of how they just really tried to cover, to have very skimpy coverage. So these are the ways of thinking about how much the Affordable Care Act has changed what the health insurance purchasing setting was like for individuals, because now there are minimum standards that have to be met. The fine print is very limited that can be put on these plans. And of course, there are large subsidies available through the marketplace, as well as discussed all the other ways, Medicaid expansions that are provided. So I'm only going to echo here some of the things that James and Angieszka and Matt have talked about, in the fact that there is this research very much along the lines of many things that economists study about whether there are certain things in the job market that make you lock into something. But health insurance has been picked on this literature a lot as something that we think will cause these. So as we saw, researchers have used the fact that the tax deductibility of employer health insurance has changed to see how does changes in price affect whether you can get health insurance to be able to get to be self-employed. And mostly it's measuring self-employment. They do not look at whether you're opening up a 10-person business or so. Mostly it's been on self-employment or in some cases self-employed with employees. But research post-ACA has, as James said, there's certainly you can see that there is an increase in health insurance among entrepreneurs, among self-employed, all through all the different avenues, young adult mandate, Medicaid, and marketplaces. But many times we're not well powered to be able to detect effects that aren't very large. So the populations that have been found to have increased self-employment, as opposed to you're sticking with your decision to be self-employed, but now you have new coverage, is that there's weaker effects on that, except for certain populations, as you saw. So I think this is just a research area that there's a lot of evidence about just how important this is as a resource for those who are self-employed and for encouraging entrepreneurship, because it's so structurally geared towards large employers getting better coverage and lower premiums.
Thanks a lot, Sally. Now we are going to open the discussion. And given the time constraints, I'll just start with my own question. And if there is any question from audience, well, I'll just raise that question again. So given the time constraint again, I have one big question. So we learned a lot about these health insurance coverages for the self-employed, and also there might be some effect because of that limited access. And another issue is about the high cost. So based on what we learned from our research, I mean, what kind of a policy implications that we actually bring, especially to the current situation under the the big pandemic shots to these small businesses and self-employed and entrepreneurs. Can you just give a quick answer, really quick, short answer, maybe less than 1 minute from each panelist?
That's a huge question for 1 minute, but I'll try. So on cost, I think that this is the big thing we've got to figure out in our health system is how to win in prices and cost. So we're in the middle of an election, and I think that there's two competing views over how we tackle that. The Biden camp is looking at expanded subsidies in the non-group market, lowering the amount of someone's income that's being dedicated to purchasing insurance, so that presumably entrepreneurs who have higher incomes will still have access to the non-group coverage. And there's some discussion of allowing people who've got an offer from an employer to then still choose to purchase coverage in the non-group market to the health insurance exchanges. Conversely, the Trump administration wants to take on costs by creating plans that avoid the sort of regulations in the ACA, which will then be skimpier, will sort of be not meet the minimum standards or the coverage requirements in the ACA, but would be lower cost. So there's obviously trade-offs with that when people need to use services and understanding how their insurance is working for them. So I guess that's still really much an open question that we're trying to figure out as a country.
Thanks. Who want to go next? Angieszka, you want to?
I think I can just reiterate what James says. We just need to vote at this point. Go out and vote.
Thanks. Either James. Okay, James, can you go?
Sure. Yeah. I think at different levels of things that would actually solve the problem versus what's realistic, I think the best solution would be to bring costs down, not just the cost of insurance, but the cost of healthcare itself. We do have by far the most expensive healthcare in the world in terms of the amount we spend on it. That's very much a whole other discussion about how we might do that. I'll just say that there are a lot of ways to do it. You've seen Taiwan switch to a single payer system and have very low costs and long life expectancy. You also have other models like Singapore with some of the lowest costs in the world and high life expectancy and a kind of unique, somewhat more competitive system. All that seems extremely unrealistic to me in the US for reasons of political economy. So going towards things that are a bit more realistic, just on reforms on the insurance side. Again, ideally, we would find some way to separate employment and insurance, or to make that more easily available. Barring that, the one policy that we've been able to see some of the research on, and that might really be expanding more, is just Medicaid expansion. And I think that could be beneficial, but I think it needs to be carefully designed. So, Medicaid expansion can do a few things. It can provide health insurance to certain people, including potentially some early stage entrepreneurs. It can provide a safety net, right? So that people are more comfortable taking out and going out and taking the financial risk of starting a business, whether or not they're currently on Medicaid. And then it also changes people's incentives potentially to work and to save. And that's where I think the details really matter, because you can do that potentially in a way that actually increases the incentive to work and save for some people, but also in a way that decreases it, that can decrease it, as somebody in the last panel mentioned, where if you require that people on Medicaid can only earn $2,000 a month or can't save more than $2,000 or $3,000, it's going to be hard to run a successful business. If you're worrying about being too successful and losing your insurance. So the details really matter there, but that's one of the more realistic policy changes that might at least help some people.
So Kosali, you want to make the final?
Sure, I'll keep this really short. So we look at other countries, they've got different systems that are not so tied to employment. And certainly thinking about where we are politically, this is not, Medicare for all does not feature in the current platforms of the political candidates that are likely to, be deciding what the future looks like. But there is also, in addition to expanding Medicaid, there are incremental changes within Medicare. So, for example, one of the things in the Biden campaign platform is changing the age of Medicare eligibility to 60. So that has implications. What James has talked about of Medicare availability is another tool of breaking those connections between employment and health insurance.
Yep, thanks. I think we don't have other questions from the audience, and now because we are end of the time, past a little bit 2 more minutes. So I really want to thank you all because I mean it's a really great research, and I personally learned a lot. And I think, I mean, there are, definitely some big issues in the, the linkages between the health insurance and self-employment, especially in the US context. And I think, I mean, there is definitely more research to understand and also provide a more evidence to the, policymakers so that we can actually make the good evidence-based policymaking process to fix these healthcare issues. And also promote more the entrepreneurship in the US. So now I want to conclude and want to pass my mic on to the Kauffman Foundation. Thanks.
Thank you, Kyung Lee, and thank you everybody for participating in our forum today. I learned a lot. I want to echo Kyung Lee's comments. I learned a lot, and I hope you as well. This is a very interesting topic, and I'm sure that this is just the beginning or a continuation of the conversation. I wanted to take an opportunity to share upcoming forums that we have scheduled in the next few weeks. We have diversity and inclusion in entrepreneurship research community coming up in November. On November 13th, I shared registration link in the chat. We also have a Future of Work, Entrepreneurship and Inclusive Prosperity Forum coming up on December 3rd. Currently, we don't have a registration link, but if you sign up for our Insights to Entrepreneurship newsletter, you will get a notification when that link is ready. Again, I want to thank everybody for participating. This forum is recorded. We are planning on sharing it out once we have made some cosmetic cleanups. And if you have any questions, please reach out, and I hope you have a great rest of your day.